Hi everyone, very good evening guys. I hope I'm audible and visible to all of you. And are we all set? Can we get going? So if you remember, what all had we studied? We have studied the tough part of patho of this chapter is done. Necrosis, apoptosis, mechanisms, hypertrophy, hyperplasia, metaplasia, वो सब हो गया. Now I'm coming on to easier topics, and by easier I mean where you will see a photo, you will read about it and over. There is not mechanism, molecules, and those intricate details, and all of them are gone. Now you have simple photo here. What does it mean? What is a short note? No long question now coming your way. So today's entire class that we study is all about short notes, and for students who've joined in now, I hope you remember this slide. I copy paste in every PDF of mine because this is the first class that I taught you that these are all the things that you'll get in pathology to write, and this is how you're supposed to write a question. So now I'm not going to repeat it every time today because we will save time. So Sara topic, whatever we study today for 2.5 hours, everything I will teach you that you have to write an introduction of 2 to 3 lines. Then you have to write the main short note that is required, and in the end you have to write 5 bullet point summary that will make up any short note that you're targeting. So are we ready for it, and should we get going? Question number 1, you will never get a short note on intracellular accumulations. If you get a short note, you have so much to write that you can, even if you skip 10 points, you will still get a good short note. So we will have something on a smaller topics that we will study. But matlab kya hai? Writing part we will do later on. First, for 40 minutes with me, understand what the topic is, then we will take out short notes out of it. Intracellular. Inside the cell, accumulations, things are accumulating. Let's analyze. So let's forget all this theory part. Think of common sense from your life point of view. Have you all heard of atherosclerosis? We know that it is that in the coronary artery or in the arteries of the heart, fat gets deposited. So can I say inside the cells of the blood vessel, fat is getting accumulated? That is intracellular accumulation, ma'am. So fat is getting deposited, intracellular accumulation. Calcium is getting deposited, intracellular accumulation. Tell me, what is the reason that of our skin color, some people are fair, some people are dark skinned, some people are medium tones of skin. So what is the color? Because of melanin. So you will say melanin pigment is also accumulating. In people who are darker, they have more melanin accumulating. People who are lighter have less melanin accumulating. So intracellular accumulations is just about different things accumulating, and that is where we start off with. The first thing that you need to know is going to be pigments. Now pigments means, like these days, thanks to the AQI of 400, 450 or even beyond that we are living in, what are we inhaling all the time? All the time we are inhaling bad particles, pollution, carbon. So can I say carbon will go inside my lungs? And all of you, have you seen that video before every Bollywood movie where they show you black color lungs, and then they also show you a story of Mukesh, and then they show you black color lungs? Why have the lungs become black? Because some pigment from outside has come. Obviously Mukesh has not suffered from lung cancer because of pollution. He has suffered because of smoking. But smoking bhi kya hai? Smoking is also carbon that you are inhaling. That is a pigment, exogenous pigment that you are inhaling. From outside you are inhaling black color. That is why your lungs are becoming black color. But what about endogenous? Means something that I am making on my own. What am I making on my own? The skin color component I am making on my own. So pigments are of two types, either from outside the body or inside the body. If you start your short note, you will get a short note on what are the pigments of intracellular accumulations. If you start off by making a summary that, okay, exogenous and endogenous, that is when the examiner will know that you have studied it with a lot of concept and with a lot of clarity. Let us get going. My concept right now is starting with the pigment that we have, the endogenous pigment, and that is melanin. Can you fill in the blanks for me? I will write the first one. Where is melanin present? It's present in the skin. It's present in the skin, which is obvious. Apart from the skin, where else it is present? It is also present in the hair. So our hair color is also because of melanin. Some people, everyone has different hair color, so because of melanin. Simple, this everyone knows. Someone who has not studied for the exam will also write melanin is present in skin and hair. But where else is it present? Do you know melanin pigment is also present in your brain? And this you must have studied in anatomy. Which part of the brain is melanin pigment present in? It is present in substantia nigra. Melanin pigment is present in substantia nigra. That is very important for you to know. Okay, so now it's not some ratta that we are doing. We are becoming doctors. Everything that you study in path needs to have a clinical correlation. So now you will tell me that what is the clinical correlation that I can have with melanin. Have you all heard of a disease faintly also, do you have an idea what is Parkinson's disease? Might be you have seen it around you in the in your neighborhood or in your relatives or the elders of your family. Parkinson's disease is a disorder where as a fresher, I can tell you two things. Number one, there will be tremors. You will notice tremors in the fingers and the hands, and there will be difficulty in walking. Walking matlab gait abnormality. Gait will be abnormal, walking matlab problem hoga, and there will be tremors in the fingers. Why does that happen? Have you ever wondered? The main reason is Parkinson's is a problem in the brain, and what has stopped happening in the brain? Ma'am, the dopamine production is a problem. There is a decrease in which neurons? Dopaminergic neurons. So why am I comparing this with melanin? Because now I take you to biochemistry. When the decrease in dopaminergic neurons happens, you're like, okay, all those tremors and all happen fine. But if dopaminergic neurons are not there, then will dopa form? Dopa will not form in the brain. Again, why with melanin? Go back to biochemistry. Have you studied how is melanin formed? Who is the precursor of melanin? Simple, dopa is the precursor of melanin. So if dopa will not form, then melanin will also not form in the brain. So in the brain, substantia nigra was supposed to have melanin. But now if the brain doesn't have dopa, there will be no melanin. So you tell me, melanin to ma'am brownish color, we can see our skin and tell. Brain should be looking brown in color. Substantia nigra should be brown normally. Will this substantia nigra look brown? No. So now the substantia nigra becomes pale in appearance. Has everyone understood that why in Parkinson's disease do they say that the substantia nigra becomes pale? Because there's a problem in dopaminergic neurons. No dopa means no melanin, and no melanin means the substantia nigra does not have a color. Is that okay with everyone? Settled? Can I move forward to more? This was your medicine correlation. These are the kind of boxes which you study, you remember and you feel, wow ma'am, that's amazing how I compared a skin pigment to the brain. But if you don't write it properly in the exam, you will not get marks. Whenever you write something like this, why did I write a heading, clinical correlation? Make sure when you write a short note, this is put up in a box in your answer sheet and you have labeled it clinical correlation. So the examiner will know that you have not just done a ratta and a mugging up of text and come in the exam. You have actually studied it in depth. Now coming to the next one, back to pathology. If I want to look at melanin, what have I got over here? I've got you a picture of the skin. For those who don't know, and you should be knowing, anatomy first year, you must have studied histology. Whether you understood or not is a separate thing, but you must have studied. So why is this the skin, guys? Because what is this entire layer over here? The topmost is epidermis. Basic I'm asking you, abhi skin is a different chapter. But in the skin, what is the basal layer known as? The one right at the base. So right at the base is known as stratum basal. You know, melanin, out of these five, there are 5 layers in the epidermis. In the bottommost layer, I'll zoom in more. Can you see some brown color? And the rule is, no one does yes ma'am just to say that हाँ समझ आ गया. You see it and only then you say yes. If you don't see it, you say ma'am I can't see it, make me understand. Can we all visualize some brown pigment in these cells? They are looking different. Let's roam around. Yes, we can see some brown pigment more over here. Let's roam around. I can see a lot of brown pigment over here. So all this brown pigment will tell me that, oh, this is the melanin. It is a brown black pigment. Can you tell me in which layer of the skin is it present? It is present in the stratum basal of the epidermis. Okay with everyone? Settled? Can I take it forward? So now you've understood how melanin looks like. Ma'am, in the skin, if some people have more of melanin over here, they will be darker skinned. And some people have less of melanin over here, so they will be lighter skinned. Now if you want to confirm, कि ma'am आपने zoom in करके you showed us, so we understood brown. But we as second prof students, we might look at this picture and we will never see brown color. So if I want to confirm, I will always use some special stains for melanin. So please remember the special stains that we have for melanin are going to be total 4. So dhyan se sunna, because I have seen students only write 1 in the exam and come in their university exam and don't get full marks. I want you to write all 4 because I am not training you to pass your prof exam. I am training you to get the topmost marks in your college, in your university and in your class. So number 1, the special stain for melanin is Mason-Fontana. What does that mean? I will show you the same. See, this is the same skin wala slide, but what is the difference? You guys tell me. Can you see in the basal layer, stratum basal, the color is now, ma'am, become very black. Can we all see that? Zoom in, see the color of melanin has become black. Why has it become black now? So jet black in color, because I have used a stain called Mason Fontana. Mason Fontana is a silver stain. ये सब भूल जाओ. Come back to basic common sense of life. Have you ever seen any silver chain or any silver bracelet or silver koi there is any cutlery, spoon? After some time, does silver get oxidized and does it turn black? Have you seen that in day-to-day life? Same principle you apply over here. If ma'am, any kind of silver staining you will use, silver will get oxidized and the end result that I will get will be a black color in the slide. So Mason Fontana is a silver stain. This concept goes with you for a lifetime. You will always wonder, kaun sa stain, kaun sa color. I'll give you a simple concept. Whenever I say ABC stain is a silver stain, you will say, okay, got it. ABC stain is a silver stain. This means the color that I'm going to get to melanin is going to be a black color. But in the exam, please remember how we learn it. M for melanin, M for Mason Fontana. And if you're going for MCQ exams, examiner is really sadistic over there. He writes, what are the stains for melanin? Options are Mason Fontana, Mason trichrome, Mason pentachrome, because abhi there are so many Masons of pathology stains that you have to study. So remember, in melanin causes tanning of the skin. So you will remember Mason Fontana. That is what is for melanin. Stain number 1 done. Stain number 2 is for melanin is known as the Schmoll stain. You can see very well below that Schmoll stain is giving what kind of a color? It's giving a bluish greenish kind of a color to melanin. So I will write blue green, and how I've learned it is Schmoll is sounding like mole. Mole is what? Mole till. Many of you must be having a mole or a till on your body, and you know it's a little darker in color, pigmented in color. So mole is melanin, and hence I've learned it. Schmoll is for melanin. यहाँ तक हो गया. Mason Fontana, black color. Schmoll stain, blue green color. Coming to the third stain, that is immunohistochemistry. Today you read this long name. After this, I will always use it as a short form. In pathology, this is read as IHC staining. Immuno matlab, ma'am, you are adding, what am I doing? If you ask me that, ma'am, when I tell you in pathology lab, do immunohistochemistry, aap karte kya ho? What do you do? So I'll say simple, break the words. Immuno means I'm going to use some antibodies, immunity antibodies. I will take a solution of antibodies. Histo means tissue. I will add it to whatever skin and whatever tissue you have given me. And chemistry means there will be a chemical reaction. This chemical reaction always and always is going to give a brown color. Always. Please, everyone, from today till the last day of pathology and me teaching you, immunohistochemistry always gives a brown color. So now what are the immunohistochemical stains? Number 1 is going to be HMB45. Number 1 is going to be HMB45. Second one, I can think melanin. So melan A, common sense, yaad rahega. And the third one is going to be S100. So what are the 3 immunohistochemical stains for melanin? HMB45, melan A and S100. Coming to the last one, which is the enzyme histochemistry. Important. Enzyme means, ma'am, you can actually stain, give color to tissues using enzymes. हमने तो पढ़ा था that in biochemistry enzymes can only change one thing to another. Pathology is so beautiful that using an enzyme, if this is my slide, I put an enzyme on top of it, this slide will show a color. Which enzyme? And once I say the name, you will be like, oh, so easy to learn. The name of that enzyme is going to be dopa oxidase. The name of that enzyme is dopa oxidase. Why dopa? Because common sense, if I'm going to stain for melanin, the precursor of melanin is dopa. So dopa oxidase will give a color, and that's your flashcard that you have. मैंने बहुत छोटा करके, I've made it very concise. In the exam, don't write it like that. Write it alag bullet points so that the length of your answer also increases. Everyone, without me showing it to you, what are the stains that you have which you have to revise for melanin, because melanin is done. So tell me 5 questions of melanin. Number 1, what is the original color of melanin? It is brown-black pigment. Number 2, tell me the stains. So M for melanin, M for Mason Fontana, silver stain hai to black color, ma'am. Number 3, Schmoll stain, so mole, it is going to give a blue-green color. Next, immunohistochemistry, always brown color. There are 3 things coming under it: HMB45, melan A as well as S100. And the last one is enzymatic method. Enzyme ke liye it is going to be dopa oxidase. MCQ bhi kar lo ek. If 1, 2, 3, 4, everything was written in options, option A, B, C, D, and they asked you which out of these is the best. So please note that the best one is going to be the enzymatic method. Okay, ABC, it was just an example that I was giving you, Dr. Om. There is no stain called ABC stain. I was just saying that whichever stain, if you ever forget, what color does this, like you forgot, Mason Fontana used to give a black color, or you used to give a blue color, or it used to give a brown color, or a pink color, or a yellow color. As soon as examiner will say Mason Fontana is a silver stain, you'll be like, silver always gets oxidized to black. Similarly, I say ABC stain, XYZ stain, DEF stain, koi bhi PQRLM, any kind of stain I say. If I say it's a silver stain, you will always say it's a black color. Done? Yes, guys, the number one pigment is done. We were doing pigments. Under pigments, I have taught you melanin. The first pigment that I taught you was melanin. Now let's go on to the second pigment, and that is going to be hemosiderin or iron. That's so simple, guys. Hemo ka kya matlab? What is hemo reminding you of? Hemo, I think it's blood, bleeding, someone is having a road traffic accident, blood is coming out, ma'am. Hemorrhage is happening, some fight happened, they hit each other, lot of blood is being lost. Hemo means lot of hemorrhage, hematoma, blood. And what is blood going to have? Blood has a lot of iron. Sidro word means iron. So in simple words, can I say hemosiderin pigment is nothing but iron? So you tell me, break the word hemo. This will be seen in some kind of a bleeding situation. You call it bleeding, or you call it hemorrhage, or you want to call it hematoma, your wish. As long as you are writing something to do with bleeding, chalega. And what is it composed of? It is composed of iron. Exactly, that is the composition. So now forget this photo. Please don't look at this photo right now. If you ask me that, ma'am, all these stains and all I don't have. You have a person who met with a road traffic accident. He had a bike accident, and after that bike accident, he had a lot of blood collection in his forearm because he went on the road. He went, for a considerable distance. There was a skid and he got hurt, and there was a big collection on his forearm. After that, on his forearm, there, for example, if this is the forearm, there was a big 4 centimeter big mass on his forearm that had only blood. So what I did, I removed that blood because he was having a big swelling, he was having difficulty in doing day-to-day activities. So I removed all that blood. When I saw it under the microscope, what will you see? When there is a lot of blood, what will a lot of there be there? Iron hoga. Jahan blood, wahan iron. So can I say wherever a lot of blood will accumulate, which pigment will form? Hemosiderin will form. You are looking hemosiderin under the microscope. What color does it get? It is going to be yellowish, brownish in color. Iron original color without adding any pink, blue, yellow of pathology. Original iron, if I look under the microscope, it is yellow brown. So hemosiderin is yellow brown and it is refractile. What do I mean by refractile? Basic refractile means, ma'am, something that shines. Now, the best part of teaching two subjects is that I can make you understand so many things by correlating. In the last class of microbiology, do you remember I taught all of you one microscope, the basic microscope? Let me ask you a question and then I'll explain refractile. Do you remember the main part of the microscope was the stage on which you were keeping the slide, and then below the stage there was something that was bringing the light onto the stage. What was that material known as? What was that part known as? Condenser. Ma'am, condenser was present below the stage, and the condenser used to condense all the light. It used to bring all the light onto the slide. So now whenever you want to see whether something is shining or not, next time, when this is not something any textbook will tell you. Only a pathologist can actually tell you how to do this, who has practiced for some years and knows how to use a microscope well. Next time when you go to any lab, and in your pathology practical, they give you a slide of hemosiderin. What will you do? You will take that slide, you will put it over here, and this condenser, on the side you will see there will be a knob. You can actually, there's a lever with which you can pull this condenser up and down. You will push it to the bottom most. As soon as you bring, it's a size, small chota sa side pe knob hota hai. As soon as you bring the condenser to the bottom most, you will realize that, ma'am, the condenser was supposed to be here so that all the light used to get here It's like a spotlight you used to create. Now if you bring the condenser down, the spotlight will not be created. Can I say the overall lighting will become very light, and as soon as the spotlight decreases, light dim hota hai, you will see some material shining. So if you want to see whether a particle shines or not, what is the step that you have to do? Only practical. You have to bring the condenser down of the microscope, and if that thing is a shiny refractile thing, you will see some sparkles happening in the slide. You will see some magic happening. You will see some refractile material. You would have done that with melanin. Melanin shine nahi karta. You would have done that with copper or with any other metal. It doesn't shine. What shines is hemosiderin. Hence I wrote hemosiderin is refractile. But now ma'am, not every student knows that hemosiderin is refractile. Plus we are new fresher students. How will we know so many intricate details of a microscope? Can you confirm that truly this is iron? Can you give me a special stain? So what is the special stain for iron? Now comes this picture. Over here, iron has become blue in color. So there must be some blue color stain called the Prussian blue stain. What is the stain for iron? It is a Prussian blue stain, which is also known as the pearl stain. This goes on for not just path, I mean till the end of your medical career, which means till your retirement and till your end of life. This goes on forever. Whenever someone writes iron, the special stain will be asked, and that is pearls or Prussian blue. But no one asked me which form of chemistry mein jaate hue, which form of iron are we talking about over here? We are talking about Fe3 plus iron. Yes, we are talking about Fe3 plus iron. For that, pearls or Prussian blue is the special stain. This means, ma'am, in my body we also have Fe2 plus iron. This no one will ask you in university, no one will ask you in Viva also. I am preparing you for, it's a all-in-one lecture. So if you are an INICET aspirant, you want to target the top 10 rank and go in for central institutes, they will ask you what is the special stain for Fe2 plus, and that is known as the Lilly stain. This is known as the Lilly stain. Dr. Himanshu, initially I was in the first 2-3 classes, I was teaching in a mixture of Hindi and English, but the feedback that I got was that there are some students in our class who don't understand, who are probably from South, and they don't understand any Hindi at all. So even 1 or 2 words they don't understand. So then I will have to use a language that everyone can commonly understand, but I will try my best that in between I can repeat some things in Hindi also, so that you can also have an understanding of it. Okay. So coming back, we have done with the second one also, second stain also, second pigment also done, that is hemosiderin. Now coming to the third pigment, and that is going to be lipofuscin. Lipofuscin has so many names. Lipofuscin, lipochrome. कुछ common दिख रहा है? Can you see something common? Lipo word is common. Lipo refers to what? Fat. Something to do with fat has come. Let's see. Let me see other names of lipofuscin. Lipofuscin, lipochrome. It is also known as senile atrophy. मतलब बताओ, what do you mean by senile? Ma'am, senile means old age. So is this pigment going to be seen in a 5-year-old or an 85-year-old? Of course, old age में दिखेगा, तो ये normal है. This is a normal thing to occur in any person in old age. You don't expect it in a 5-year-old child, but you expect, do you expect an 80-year-old person to have lipofuscin pigment in the body? Yes. 85, 90-year-old, 95-year-old, yes. So what is the color of lipofuscin? Can you tell me yourself by looking at this picture? Ma'am, it looks to be brown in color. तो इसका एक और नाम बताओ. The other name is now known as brown atrophy. All these, see, lipofuscin 1, 2, 3, 4, 5. नाम ही नाम है. There are so many names. Number 1, lipofuscin. Number 2, lipochrome. Number 3, old age. अच्छा, old age तो senile atrophy. Number 4, it is brown in color. Okay, brown atrophy. But है क्या मैम? What are you trying to teach me? Why is it seen in old people? Now comes the last name. This is a telltale sign of free radical injury. This line everyone has mugged up. Ratta laga liya, no one knows the meaning. So today understand the meaning. Telltale sign of free radical injury. What do you mean by free radical? Today I can teach this to you because you are going through it. Unfortunately, all of us are going through it. I will teach you with the example of the air quality index that we have. Today we are breathing in an AQI of, let's take an average of wherever we are living, somewhere between 300 to 450 AQI all of us are living, let's assume. So when we are inhaling all those dangerous particles and pollutants, and not just air quality, the water quality is bad, the food has pesticides, chemicals, toxins, poisons, So many things are entering your body. You know what are they making in your body? They are making free radicals, and these free radicals are causing injury in your body. So let me just tell you, and after that, breathing in this air every day, like I read it, and after that every minute I have this happening in my mind in this AQI. Sorry, but this will happen in your mind also now, that whatever bad air you are breathing, it is creating free radicals. And do you know what free radicals is doing? It is destroying the lipids of your body. It is causing lipid peroxidation. Okay, so ma'am, all my cells, all the lipids are getting kharab, all the lipids are getting spoiled. Lipid peroxidation is happening. That is why which pigment is formed? Lipofuscin is going to be formed. Okay, now I understand that free radical, as the free radical will keep on increasing, means the more I breathe in this air, the more lipid peroxidation will happen, the more lipofuscin will form. Yes, so if you see an 85-year-old person, he has gone through so many years of the air insult, water insult, so many years of damage. So he will have a lot of lipofuscin. Whereas a 5-year-old baby, he has not gone through so much of insult from the environment. So he will have very little or no lipofuscin. So can I understand now that why has word lipo come? Because ma'am, it is formed due to the lipid getting spoilt in my body. It is causing lipid peroxidation. That is why lipofuscin pigment is formed. Hence you named it lipo. So now you will have to look at this photo again. You will have to tell me the color. Color you have already told me. It is brown in color. Where is it present? If what is it now? Though you guys are, this is your third class in pathology, but I have taught you this much. In a cell, what is this blue color thing known as? This is known as the nucleus. Yes, and around the nucleus I can see the pigment. So can I say that the location is going to be perinuclear? It is a perinuclear brown color photo. If I want to zoom in and show you again, look at one more picture. This blue color thing is what? This is the nucleus. What is around it? This brown color thing, this is the pigment. So as I said, this is going to be a perinuclear. This word is very important. MCQs mein, you know, it is so important and so characteristic that MCQ will come off say 10 lines. You will be able to solve it in exactly 5 seconds, because you will read 83-year-old man with a perinuclear pigment, and you're like, I don't care about the rest of the history given. Baki ka question ignore. Answer is lipofuscin. 83-year-old person, perinuclear pigment, it cannot be anything else. But prove it. What are the special stains? For that, I will want you to break it. Break it into 2 words. That is going to be lipo and fuscin. So let's get going. Lipo means it has lipid. Do you know any stain for lipid? It is going to be oil red O. Oil red O is a stain for lipid. So lipofuscin is oil red O positive. And how I have learnt is fuscin. This you will tell me because I taught you in the last class. In the last microbiology class, fuscin we have learnt as fast. What is that microbio stain which was acid fast? Like I said, TB is acid fast. Which is that stain? Is it Gram stain? Is it Zn stain? So I think all of you can recall, it is going to be Zn stain. So how do we learn lipofuscin? Lipo we learn as oil red O because fat, and fuscin we learn as fast. So that is very good. I got the answer. That is Zn stain. Yaad ho gaya. Lipo and fuscin, oil red O and Zn stain positive. So the third pigment is also done. Now I want to show you an electron oh no, I said the name. It's a black and white photo. When I show you a black and white photo, which microscopy am I talking about? So now I've already said it. So that is going to be electron microscopy. So see, I'm trying to show you the same thing, only that it's now become black and white. So in this cell, this big thing over here is the nucleus, and around the nucleus I can see some black dots. So that must be perinuclear pigment. Once again, it is going to be lipofuscin. Whichever photo they show me, nucleus hai, pigment hai, perinuclear hai, it is lipofuscin. The third one is done. Now we move on to all the other pigments in one slide. So what is my what help I need from you? I will name the pigment, you tell me the disease. So one thing, if you will tell me, then it's a give and take. You tell me the disease, I will tell you the stain. So you tell me clinical part, common sense part, I will tell you pathology part. So can you think of a disease in which copper pigment increases? What is that disease? Person has lots of copper in the body. Copper overload. What is that situation known as? Copper overload condition is known as Wilson disease. For those who not just new, never mind. Copper overload is known as Wilson disease. So now when a person comes to me with Wilson disease and he has too much copper, in the liver also there is copper, in the brain also there is copper, in the eyes also there are copper, you will say, ma'am, what is the special stain for copper? So let's get you to one of the most famous movies. Copper ends with R, so the names of the stains will begin with R. What is RRR? So the number one stain that you have over here is going to be rhodanine. And the next stain that you have is going to be rubianic acid. So simple. What are the stains for copper, guys? Rhodanine and rubianic acid. And I can correlate microbiology whenever I want, because in the last class I taught you a stain. Micro mein rhodamine pada tha. That was different. In pathology for copper I am teaching you rhodanine. Totally alag. Where did I teach you rhodamine? I gave you this mnemonic in the last class and I told you, promise karo, you will tell me in pathology. So today is the time to fulfill that promise. Rhodamine, ma'am, you had written that time also capital M, because that is the special stain for Mycobacterium TB. Rhodamine is for Mycobacterium TB. Separate. For copper I'm talking, yes, very good. Dr. Anish says, ma'am, yes, we remember वो fluorescent microscope में पढ़ा था, fluorescent stain था rhodamine. Auramine, rhodamine were for Mycobacterium TB. Perfect, very good. Many more students remember this. Amazing. So now I know rhodanine is going to be for copper and rhodamine is going to be for MTB. Copper is done. Very good, guys. You know it. So RRR for copper, rhodanine and rubianic acid, copper is settled. But since all of you have been very, very nice, I want to ask you one more thing. Copper, tell me physiology. Does copper travel alone in your blood? Like normal, some amount of copper you and I normally also have in our body, right? So does copper travel alone? Rule number one, no one is allowed solo travel in your body. Anyone who has to travel needs a travel partner. Koi solo traveling body mein nahi allowed. If iron has to travel, God has given a travel partner to iron. If copper has to travel in your blood, God has given a travel partner to copper. So can you tell me who is the travel partner of copper? Ceruloplasmin. So whenever copper is going in your blood, it is copper and it is ceruloplasmin together. When they will be together, only then they are allowed to travel in your blood. So you have told me, what are the special stains for copper? For copper, ma'am, you had said rhodanine and rubianic acid. Can you tell me for its travel partner, do we have a special stain? This will be asked for higher institute exams. For travel partner, ceruloplasmin, the special stain is going to be the Orcine Shikata stain. देखो जब INICET के लिए we prepare questions, automatically the name also becomes tougher only. Orcine Shikata stain is the stain for ceruloplasmin. But my story is that I will always teach you path micro integrated. So if someone asks you, say Orcine Shikata stain, patho mein to you have told me it is for ceruloplasmin, which is the travel partner of copper. But where in microbiology can you use Orcine Shikata stain? So I'll take its first name. Orcine Shikata stain can be used for three things, and because students were having a lot of problem in learning what three things, I have given them the name Orcine Shikata, and the mnemonic is also Orcine. Let us figure out what is this mnemonic. So number one, or is for some organism. Have you all heard of hepatitis B? Of course, even without reading medical books, you know hepatitis B. So hepatitis B surface antigen, this organism is positive for Orcine. Next, CE, what is the copper buddy? Copper buddy, ceruloplasmin is positive for Orcine. And finally, ENE stands for elastine. So now you know what are the three things positive for Orcine Shikata stain. The organism hepatitis B, ceruloplasmin and elastine. Now will you remember this always? I mean, even for INICET people tend to forget because that is very top-notch information. But if you learn it this way, you will remember it for a longer time. Organism, ceruloplasmin and elastine. These are the three things for which Orcine Shikata stain is used. Coming back, copper pigment done. University question done, NEET PG done, INI done, सारा questions हो गया. Now let's come to the next pigment, hematin. Do you know the other name of hematin pigment is hemozoin? And sounds very difficult, but is a very, very simple disease that in which this pigment is formed, and that is malaria. Means every rainy season when people have malaria infection, that infection, when malaria enters into the body, which pigment does it form? Hematin pigment, hematin, hemozoin, same thing. Bas, that's all that you have to know. Coming on to the next one, anthracotic pigment. Sounds like such a scary name, anthracotic. Now I'll tell you the simple name for it. carbon. So that black color lungs that I was telling you, Mukesh wala story, and wo black color lungs, you and I, if you smoke, then you definitely have black color lungs. But if you are like me that you don't smoke, can you still have black color lungs? Yes, because you live in Delhi or you live in North India or a part of the country where the pollution is too much. You are anyway inhaling a lot of carbon, so you can still have black color lungs. Anthracotic pigment is going to be nothing but carbon. So in which situation? Don't tell me situations like smoking and bad pollution. I mean, that is no disease, that is an environmental thing and a habitual thing. Tell me a disease. Someone, ma'am, working in the coal industry. Yes, someone working in the coal industry, that person, because someone works for 20 years in the coal industry, every day he's inhaling carbon, he will end up having anthracotic pigment. What is the color? It is going to be black in color. Okay, obviously carbon hai black in color, easy. Coming to this, so this time, next time, whenever you watch a Bollywood movie, and before that, starting mein Mukesh wala story comes, and then they show you the black color lungs, and they squeeze the lungs and they say coal tar is coming out of it. That coal tar black, you will not call it carbon, you will call it anthracotic pigment. Coming to the seventh and the last pigment, homogentisic acid. You are the ones who can tell me this the easiest way and the fastest. What is the disease in which homogentisic acid is increased? Homogentisic acid is also a black color pigment. Where is it seen in? What disease? It is seen in, yes, anyone? It is seen in alkaptonuria, because you have just now studied it. Very good. You have just now studied it in biochemistry. Ma'am, homogentisic acid is a black color pigment that increases in alkaptonuria. Later on, I will teach you. This alkaptonuria goes to three places. Three places. Can you tell me? Number one, it tends to go into the urine. So the color of the urine can become black. It tends to go into the cartilage, like the tip of the nose. So it is going to go to the cartilage like the nose or the ear lobule, jahan jahan cartilage hai. And number three, it goes to the nails also. So the nails also become black. Urine becomes black, cartilage becomes black, and nails become black. That is why this disease was also known as, ochronosis, deposition of, very good, homogentisic acid, alkaptonuria. Iska ek aur naam hai, that is ochronosis. Finally, all your pigments are settled. The first thing, and now I'll take a small quiz and I'll get to know whether you were sleeping or whether you were listening. Overall, I realize pigments are of two types. Either they will be formed in the body or they will be formed outside the body, right? Out of them, can you tell me which were the black ones? All the black pigments only that you can tell me. Number one, melanin. I think melanin, all of you remember, is definitely black. Brown, black, depending on skin color. Second, the lungs getting black. What was that pigment? I won't call it carbon. I will call it something else. I will call it anthracotic pigment. Yes. And lastly, if someone has alkaptonuria, then homogentisic acid is also going to be black in color. These are the three black color pigments. So this is okay, ma'am, we know it. Now let me ask you a common sense question. Which is the only black color pigment out of these three which is going to be exogenous, means coming from outside the body? Melanin we make on our own. Homogentisic acid is a disease, but human beings are making it. It's a disease in human beings. We are making it inside the body. Which is the one that is coming from outside the body? Exogenous, and that is going to be anthracotic pigment, that is carbon. These are the three things that are black. Rest nothing was black. This is what you studied. So we are doing a topic called intracellular accumulation. This is your summary slide. The first thing that I have taught you out of these is pigments. सबसे lengthy था and वो खत्म. Coming to the next one, what else can deposit inside your organs, inside your cells? Fat. ये तो सबसे common चीज है, fat can deposit. So we will study about lipids. Can you tell me which is the most common organ in which fat goes? Don't say heart, because heart का photo बना हुआ है on the side. Don't go into that bias. Which is the organ? Because does fat go into your heart? Have you ever heard someone having fatty heart? I have not, but I have heard a lot of people having fatty liver. That is very commonly found. So the most common organ in which fat tends to go is going to be the liver, and hence we call it the fatty liver. Adipose or fat means the same, Dr. Anish. I mean fat, when I say lipid or fat, it is adipose tissue. That's a technical name for fat. Okay, so most common organ is going to be liver, but let's assume, let me take a scenario. Lipid goes in the heart like I have shown over here. Now this is what they will ask you. And I've drawn a very juvenile school wala diagram of the heart. And I have given you the red color heart color also. In between, I have shown you that yellow color fat is going. Can you see stripes being made? This is the normal heart and fat, then normal heart, fat, red, yellow, red, yellow, red, yellow. This is looking like a cat or a tiger. Stripes hota hai na? So what is this appearance known as? This is known as the tigered or the tabby cat appearance. This is referred to as the tigered or the tabby cat appearance. And where is this seen? So this tigered or tabby cat appearance is basically seen, number one, ma'am, you are teaching us this entire chapter of cell injury. So this can be seen due to cell injury, of course. Where else? Very good. Where else is it seen? Tigered or tabby cat appearance. I will prepare you for INI, I will prepare you for path and for micro. So this is seen in a disease called ARVCM. You will be like, what the hell? Itna lamba naam. Very simple. ARVCM is arrhythmogenic. Arrhythmogenic, everyone knows, it's arrhythmia. Patient has arrhythmia, means ma'am heart rate disturbance. Kuch cardiac problem hai, okay? RV means the problem is in the right ventricle. Fine. So where does fat go? Fat goes and sits in which part of the heart? Right ventricle of the heart. And what is this disease? What is CM? CM is going to stand for cardiomyopathy. Okay, now I know the entire disease. Abhi ke liye itna knowledge is enough. I will teach you in cardiac chapter full detail mein. Abhi ke liye I know what is ARVCM, arrhythmogenic right ventricular cardiomyopathy. In that also right ventricle mein fat goes and sits. Last question. If you can answer this, I have not taught you right now, but I will teach you in micro later on, which is that bacterial infection that can cause fat in the heart. The bacterial infection that can cause so is diphtheria. So that is going to be diphtherial myocarditis. Diphtheria can cause fat in the heart. So three conditions. Tell me, how does fat or lipid enter into the heart? Number one, ma'am, patient has cell injury. Number two, patient has this ARVCM. And number three, patient has a bacterial infection, that is diphtheria. Fat, हमने fatty liver भी पढ़ लिया. We have studied fatty heart also, which is looking like a cat or a tiger. Let's read some more organs. Let's look at fat in the gallbladder. How did you identify this is gallbladder? Because gallbladder has bile. Bile has to look green in color. So green color wala organ has to be gallbladder because it has bile. So number one, I will label all of this as bile. After that, on top of that, I can see a lot of yellowish areas. Can we all notice? There are some yellow, not some, many, entire things, small and big. Yellow stones are also there. This person has gallbladder stones. Yellow color gallbladder stones must be, yellow means fat. These must be cholesterol stones. So can I compare this with a strawberry? Because what we see in a strawberry, on top of the strawberry, there are always those yellow color dots if you've seen a strawberry, which of course you have. So like those yellow dots, the gallbladder is looking like a strawberry gallbladder, and this is known as cholesterolosis of gallbladder, because look at this, cholesterol going in the gallbladder, cholesterolosis of the gallbladder, which is going to be strawberry gallbladder. I want to ask you something. There is one cell in the body which is always hungry, always, kahin bhi khana hoga wo cell wahan pahunch jayega and is going to eat it. Which is that cell? Macrophage. Now, what better food than cholesterol? So much of cholesterol comes in the gallbladder. Who is going to come and eat it? Okay, free food. I'm going to go and have a feast. Macrophage. So now what happens? I see, and I hope you can you see all these cells? Normally when I draw a cell in pathology, I always color it pink. This time I have not colored it pink. I've left it white. Why are all these cells white? Because these are known as foamy macrophages. These are the cells, these were supposed to be pink. Macrophage is pink, but over here it has eaten, it has become big fat. Golu molu it has become after eating what? It has become so because it has eaten a lot of cholesterol. So it has engulfed all the fat or the cholesterol, and therefore it has become foamy. So now my question for you is, cholesterolosis of the gallbladder shows you strawberry gallbladder and it shows you foamy macrophages. So three organs done. Liver में पढ़ लिया, heart में पढ़ लिया, gallbladder में पढ़ लिया, but ma'am, the talk of the town, how can you forget fat in the coronary arteries, the one that is making people die? Atherosclerosis. What is atherosclerosis? It is going to be fat in the blood vessels, and of course in the heart you are talking about, अगर heart की बात कर रहे हो तो you are talking about branches of the coronary artery. So now what they saw, this was a person who had died of myocardial infarction. उस person का जब death हुआ, so they did an autopsy. On doing an autopsy, what they found that this was the photo given. You tell me, do you see yellow color fat over here? I don't see anything yellow. क्या दिख रहा है यहाँ पे मैम? मुझे खाली खाली जगह दिख रही है. I can see white color spaces over here, and I hope you can. But this was supposed to have fat. Where did that yellow color fat go? It all got washed away. Fat is never seen under the microscope. I don't know how many of you realized up till now, even in the previous photo, when I was looking at it with my eyes, it was looking yellow in color with my eyes without a microscope. But when I started looking at fat with a microscope, ma'am, now the fat is looking all white. Where does that yellow fat run away? Because guys, I have taught you earlier also, today I will teach you again. In pathology, क्या करते हो? Do you take this gallbladder and just put it under the microscope, or do you add some chemicals? Like, do you put it in formalin? Do you put it in alcohol? Do you put it in some chemicals? Yes, ma'am. We first take this, we put it in some formalin, alcohol solution, and then we put it under the microscope. So fat is alcohol soluble. Fat will dissolve. You took this gallbladder, you put it under the microscope, fat got washed away. Similarly, you took this coronary artery, you put it in formalin, you put it in alcohol, fat gets washed off. तो यहाँ पर जो है वो fat की याद में जगह रह गई है. There is a space in the memory of fat, but the fat has actually gone away. So can I call them clefts, which earlier had cholesterol, but because you put it through chemicals, like which chemicals, if someone asks you in your viva, it could be formalin, it could be alcohol, and because of all of this has gotten washed off. Are we okay with this? Can we move forward? Atherosclerosis में क्या दिखेगा? In the memory of fat, I will see some spaces, that is cholesterol clefts. But you like, for example, that ma'am, yeah, I could see, but ये तो, this is your assumption. You are calling a khali jagah as fat, an empty white space you're calling as fat. Can you please prove it? What are the stains for fat that you have to know? Now the best part is, whatever color you are seeing for fat, that is the name of the stain. Over here, I can use red color for fat, so the name of the stain becomes oil red O. Over here, I can see a black color being used for fat, so the name of the stain becomes Sudan black B. How easy. Oil red O gives a red color to fat. Sudan black B gives a black color to fat. Then I have a stain which is giving an orangish color to fat, and that is known as Sudan 4. And then I have another stain for fat. No color you have to know, just the name, that is osmium tetraoxide. So tell me the 4 stains for fat. Any organ, gallbladder mein ho, coronary artery ho, liver ho, heart ho, these are the 4 stains you will use. Oil red O for red color, Sudan black B for black color, Sudan 4 will give you orange color, and osmium tetraoxide. But you will say, coming back, ma'am, the problem is that so many things, you are like, pathology has done so many advances, and till now you could not stop fat from washing off and running off. What is this? I want to see. You are like bent upon the fact कि मुझे तो फैट को देखना है अंडर द माइक्रोस्कोप, यहाँ पर मुझे फैट देखना है. You can't let it wash off. Is there any special machine that has come up? Yes, there is a machine called frozen section or cryostat. Name is only telling you, it's a machine, all of you can see. And in that machine, the frozen means, can you see, it's all closed, there's a glass lid and पूरा बंद है, because the temperature reads as -20, -30. इसमें the temperatures are frozen. That is why I call it cryostat. And when I freeze, like for example, you took this gallbladder and you did not put it in any alcohol and all. You directly took this gallbladder and you decided to freeze it in this machine, because after freezing, you will not require any solutions like alcohol and chemicals. This means, ma'am, freezing par to fat will not vanish. After this, now when you put oil red O, will you directly see this fat, or will you see fat washed off? There is no washing off of fat. Now fat will not get washed off. There is no washing of fat because कोई chemical ही नहीं डाला. It's something like you take food. If you want to store food and you put it in the refrigerator, you put it in the freezer, you will be able to retain food. Shelf life बढ़ जाएगा food का for many months. Same way, you took the organ and you put it under -20, -30. So now no fat will get washed off and you will be able to see it under the microscope. This was a MCQ also that was asked. Finally, lipid also done. Coming to the third thing, repeating. Pigments ho gaye, lipid ho gaya. Coming to the third thing, what else can accumulate? These are going to be the proteins. Are you ready for it? Now after this, you will realize कि topics छोटे 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 होते जाएंगे. Pigment was big, lipid was big. Protein में बस 3 example. क्या क्या proteins है ma'am that can get accumulated in my body? Who will tell me the meaning of example 1, multiple myeloma? What is multiple myeloma? It's a cancer. Cancer of what? It's a cancer of which cells? Come on. It's a cancer of plasma cells. कैंसर ऑफ प्लाज्मा सेल्स. प्लाज्मा सेल्स आर जैसे हमारे ब्लड में रेड ब्लड सेल्स होते हैं, वाइट ब्लड सेल्स होते हैं, प्लेटलेट्स होते हैं. सिमिलरली इन आर बोन मैरो, इन आर ब्लड, देयर इज ऑल्सो अ सेल कॉल्ड प्लाज्मा सेल. इट्स दैट सेल विच एक्चुअली मेक्स अ लॉट ऑफ एंटीबॉडीज. ऑल आर एंटीबॉडी, IgG, IgA, all those antibodies come from plasma cells. So if imagine there is too much of plasma cell, cancer of plasma cell, there will be lots and lots of antibodies in this person. That is multiple myeloma. तो मैम antibody क्या होता है? Antibody is a protein. This we studied in biochem. Antibodies are nothing but proteins. So if someone has too many plasma cells and too many antibodies, that person is having too much of protein in his or her system. And look at what has happened. This is just to give you an example. I will teach you this like for 1 hour. 1.5 hour I will teach you in hematology. अभी के लिए सिर्फ basic. This is a plasma cell, and by now this much orientation you have. I will label this as a plasma cell. And what is this blue color thing? This blue color thing must be the nucleus of the plasma cell. In the nucleus I don't see anything, ma'am. Nucleus to ऐसे fit and fine looking, all good. But in the cytoplasm I can see these round bodies that are formed. In the cytoplasm, all the antibodies are getting deposited because so much antibodies are being formed by plasma cell. They are making small groups. In where? In the cytoplasm. In the next photo, again, when I zoom in and I see, pick up any one plasma cell, you will say, okay, let's assume, ma'am, this is a plasma cell and this blue color thing over here is the nucleus. Now, do you see the antibodies have gone and sat where? The antibodies have gone and sat in the nucleus. So, antibodies का अपना एक वो चल रहा है. उनके, they are enjoying life. Wherever they want to go and sit, they can. They want to go and sit in the cytoplasm, they can do so. They want to go and sit in the nucleus, they can do so. I will use different names. If the antibodies, please remember, if the immunoglobulins go and sit in the cytoplasm, they are called as Russell bodies. If the immunoglobulins go and sit in the nucleus, they are known as Dutcher bodies. याद हो गया? In case you get confused कि अच्छा मैम Russell and Dutcher, I remember which was cytoplasmic, which was nuclear. So remember, Russell bodies are going to be in the cytoplasm, whereas Dutcher bodies are going to be in the nucleus. Is that okay with everyone? पहला प्रोटीन हो गया एंटीबॉडीज, रसल बॉडीज, डचर बॉडी. कमिंग टू द सेकंड प्रोटीन, अल्कोहलिक लिवर डिजीज. आई एम श्योर यू हर्ड ऑफ फैटी लिवर एंड अल्कोहलिक लिवर डिजीज. ये तो कॉमन पॉपुलेशन ऑल्सो नोज. सो एवरीवन बिलीव्स, आई मीन कॉमन मैन बिलीव्स दैट लिवर में alcohol goes and sits, and that is why person has alcoholic liver disease. You know as medicos that alcohol can't go and sit. Alcohol must be causing some damage to the liver, some problem in the liver it causes. That is what is alcoholic liver disease. Alcohol तो हमारी body metabolize कर देता है. Alcohol is metabolized, that changes things in the liver. And what does it change? It changes some proteins. So for the time being, if you look at this picture, no one will give this picture as a spotter. वो आपको बताएंगे that this is a picture which we are giving you from the liver. You will say, okay, overall white, pink, blue सब कुछ दिख रहा है. But can you notice some places I can see the pinkish color is making some kind of a cluster over here, and there is some weird pink color here and a weird pink color here. कुछ बीच में मैम some pink things are coming over here also. So what are these? These are the proteins that are getting accumulated, and these proteins are called Mallory-Hyaline bodies. So what are they? They are proteins. इतने से नहीं चलेगा. Two questions आते हैं, Mallory-Hyaline या Mallory-Denk bodies. Some people call it Mallory-Hyaline bodies, some people call it Mallory-Denk bodies. या तो Mallory-Hyaline या Mallory-Denk. Question 1, where is it seen? Alcoholic liver disease. Question 2, what is it? It's a protein. Which kind of protein? Not just protein will work. It is a protein called cytokeratin 8 and 18, many a times written as CK8 and 18. It means the same. Is that okay? So 2 questions. Mallory hyaline or Mallory Denk bodies are seen in alcoholic liver disease, and it is made up of cytokeratin 8 and 18. Second protein done. Before I move on, Dr. Om had a question. If the plasma cell, Dr. Om, when plasma cells increase, the antibodies that you're saying, they will also increase, but where are antibodies formed? Where are they formed? They are formed inside the plasma cell. So yahan pe bane in the cytoplasm, or they are formed, go and sit in the nucleus, but ultimately they will be coming out of the cell. Everything is released from the cell, right? And when they are released, where will they go? They will go in the blood. Ultimately, all antibodies have to go, the final destination is blood, so they will go to the blood. Initially, when they are formed, where are they sitting? Initially, they could be sitting in the cytoplasm, so I call them Russell bodies. They could be sitting in the nucleus, I call them Dutcher bodies. They don't go from one plasma cell to another. It is something like, if you have studied a topic and you are giving the exam, then you will write it on the answer sheet. You are supposed to write it on the answer sheet. So if you are a plasma cell, you have made antibodies, you are supposed to give the antibodies to the blood. You are not supposed to give that information as cheating to the person sitting next to you. दूसरे plasma cell, दूसरे student को वो information नहीं देना. You have to give that information to the answer sheet, to the examiner. Plasma cell will make antibodies, will give it to the blood, will not give it to another plasma cell. Is that okay? Understood? Can we move on next further? So you've done one protein called plasma cell wala, multiple myeloma, second is alcoholic liver disease, and the third one is Crook hyaline change. Have you read something about this earlier? What is Crook hyaline change? So this is also, ma'am, again I can see some pink color protein that you have highlighted, but where is Crook hyaline change seen? This is seen in a gland known as the pituitary gland. The Crook hyaline change is going to be seen in the pituitary gland, but now the interesting part is, you will think acha, in the pituitary gland some pink protein named Crook hyaline change is coming, but ye crook hai. Crook means fraud. Some fraud is happening over here. That is how I have learnt it. The disease is not of pituitary gland. You will think acha, it's seen in the pituitary, it must be a disease of the pituitary. No, this is seen in a disease of the adrenal gland. So you're like, okay, this is so different. This is seen due to Cushing disease. So Cushing disease is a disease which occurs in the adrenal gland. But dekho, problem is in adrenal gland, but where are the proteins going and getting deposited? They are getting deposited in the pituitary gland, and then the proteins are referred to as the Crook hyaline change. Are you all seeing the meaning of crook over here? Crook is कि मैम कुछ fraud हुआ है. Disease कहाँ है? Disease is in the adrenal gland, but where is the effect being seen? Crook, fraud हुआ हमारे साथ. Defect is there in the adrenal, but the effect is being seen in the pituitary gland. So 3 proteins are done for you. Let me just ask you some quick questions before I proceed. Number 1, where do you see Russell and Dutcher bodies? They are seen in multiple myeloma. Where do you see Mallory hyaline bodies? Mallory hyaline, Mallory Denk, alcoholic liver disease. Where do you see Crook hyaline change? It is seen where? It is seen in the pituitary gland. Because of which disease is it seen? Adrenal ka Cushing's disease. Proteins are also done. The 4th thing that can get deposited inside the body is going to be glycogen. So let us get going with glycogen. The 4th thing, acha, before I show you glycogen, biochemistry se batao, what are those diseases known as where glycogen increases? Because I have nothing more to teach you after that. The disease in which glycogen gets deposited in our body is known as glycogen storage diseases. No one will ask you this question. Common sense. Other than this, tell me, where does glycogen get accumulated in your body? It is, do you know glycogen is also seen in our body in diabetes? You know diabetes is all about sugar increasing and insulin ka problem, sugar ka problem, but also glycogen gets deposited. Especially which part? Glycogen goes and gets deposited in PCT. What is PCT? Proximal convoluted tubule of the kidney. When glycogen goes and sits in the PCT of the kidney, that lesion has been given a very branded name, expensive brand, Armani-Ebstein lesion. So what is Armani-Ebstein lesion? Pe aate hain 2 question. Number 1, which disease is Armani-Ebstein lesion seen in? It is seen in diabetes. Where is it seen is question 2. It is going to be seen in the PCT of the kidney. And third question, what is it? It is glycogen going and sitting in the PCT of the kidney. So number 1, glycogen increases in glycogen storage disease. Number 2, it increases in diabetes. I call it Armani, branded, expensive name, Armani-Ebstein lesion. Number 3, glycogen also increases in cancers, which you will study with me. Abhi to 6 months and we will study so many cancers. Right now, please don't learn them, just go through them. so that you know later on कि हाँ मैम ने बताया था glycogen will also increase in some cancers. Right now I don't want you to learn those cancers. If you just read through, have you all heard of kidney cancer, renal cell cancer? In that glycogen increases. Have you heard of Ewing sarcoma? Ewing sarcoma, if you haven't heard, it's a cancer of the bone. So bone cancers can have increase in glycogen. Okay, have you heard of seminoma? Seminoma is a cancer in the testes, male genital tract, testes, and उसी का female ovarian वाला tumor is dysgerminoma. As I said, you can't learn these, कोई दिक्कत नहीं, not a problem. All that you have to know, cancer can cause glycogen accumulation. For the time being, what you have to know is what is the special stain for glycogen. That is more important. And glycogen is going to be PAS positive, very tough, which I will simplify for you right now. It is PAS positive, diastase sensitive. What is the meaning of this? For that, you will first have to tell me what is the full form of PAS. PAS is known as, how do you read this? Because I have seen so many students, book में ना ये dash नहीं बना हुआ. So many students I have seen reading it as periodic acid shift. And I'm like, कोई logic ही नहीं लगाया, बस रट लिया periodic acid shift stain. No, there is a dash which tells me per iodic. ये compound है, it has a lot of iodine in it. It is not periodic. It is per iodic acid shift stain. So number one, glycogen is PAS positive. What? PAS full form क्या है? Per iodic acid shift. Anyone around you calling it periodic, please tell him or her कि iodine होता है इसमें. It is per iodic acid shift stain. Okay, what color does it give? P for PAS and P for pink. What color does it give to glycogen? Ma'am, I can see over here the full slide has become pink. So I will say, oh, this has glycogen. This is PAS positive. So now I'll tell you what we do as a pathologist, and very interesting story I will tell you. Number one, I said, okay, glycogen is PAS positive, matlab pink color, very good. But what did I write next to it? Diastase. Diastase क्या है? A is matlab enzyme. So what I do is I take two slides. Have you noticed I have taken two slides? In one slide, I am getting a nice pink color. In the other slide, ma'am, suddenly that pink color has vanished. You have put some enzyme to it. What have I done? In the next slide, I have added diastase. Diastase enzyme hai. What is it going to do? It is going to break glycogen. It will break the glycogen. So now tell me, if I took a slide, देखो, for example, this is one slide. Directly, let's assume this slide has a lot of glycogen. ये वो glycogen storage disease वाला slide है. If I put PAS on it, will I get a pink color? Yes, of course. It has glycogen. You put PAS, you will get a pink color. But on this, पहले से, what did I do? चुपके से, before you came to put PAS, I went and I added this enzyme. All the glycogen got broken down. Now when I will add PAS, when you came you thought I will add PAS, I will get pink color. But मैंने चुपके से जाके slowly I had gone and put diastase. I have vanished all the glycogen from there. Now will you get a pink color? No ma'am. Now I will get it to be colorless. I will get a white color. So can I say that diastase can break glycogen? Glycogen is very, very sensitive to diastase. You put diastase, glycogen will break off. Can I call glycogen PAS to positive hai, pink color? But if I put diastase, glycogen will break off. It is PAS positive, diastase sensitive, written as PAS DS. You might wonder what is PAS DS? PAS positive, diastase sensitive. That is glycogen. Are we all clear with this? Can I move on to the next slide, guys? Yes, because glycogen is done. Pura glycogen I have got for you in one flashcard for you to easily remember. Glycogen storage diseases, diabetes, cancers. Stain, PAS positive. What is the color of PAS? P for PAS, P for pink. So you know, another interesting story that I want to tell you is that in India, one is ideal protocol which you read in books. But then in certain government sectors, when you will start working later on, you will realize कि जैसा जैसा book में पढ़ा था ना, we don't have so many resources. So like when I was working in my residency, we were told that okay, today you will have one activity to do in your pathology lab. All of you, as when we were our junior doctors residents, we had to learn how to do PAS stain. So we were all given one slide and we were told today you have to do PAS staining and you also have to show us the diastase activity. But working in a government hospital, diastase was out of stock. Diastase enzyme का जो bottle था वो खत्म था. It was out of stock. But our HOD told us, I don't care how you do it. Search for it. So then one of our seniors told us that diastase is basically an enzyme that breaks what? Glycogen. What else can break glycogen? Even your saliva can break glycogen. It might sound very icky to you, very, very creepy and yucky to you, but actually, what many residents do in times when diastase is not available is they can actually spit on the slide, and that will also break the glycogen, because you should know your basic human physiology that to break the glycogen you can have enzymes in your saliva which can do that, and it is not something you're doing on the patient, you're doing on a dead tissue, so it is very well ethical to do it also. It's not something which is unethical. So that is how sometimes saliva can be taken and that can be used as a replacement to diastase. That is why having knowledge is so important, and that is we got saved, because this is what our HOD was testing us, that if you don't have diastase and you have to give diagnosis to a patient, will you tell him what? That my hospital doesn't have diastase, so I can't give you the diagnosis, you can't get your treatment done because of this. What best can you do for the patient? I mean, what best than using our own saliva can we do for the patient? And that is what we had done. Very good. So now this is something which I learned back then, that you will have to work in conditions where you will have limited resources. That will tell the true potential of a doctor than someone who's very, very good in their theory but doesn't know how to apply that in real life. That is not going to define you as a doctor. So every place when you study, make sure that you are training. That is why we say internship zaruri hai. That is why we say working in limited resources is important. Do have a government exposure in your life once in a while. Even if you've not studied from a government medical college, try doing your residency from there. If not, try doing a job over there. Always get resources, limited resources may test how well can your brain work. Anyway, coming back, glycogen also done, and now we move on to the last one. The last one that we have, what if calcium goes and gets deposited? So you realize na, that if I get a short note on intracellular accumulations, I have so much of material to write, but you will not get a short note. You get short notes on individual things. And last short note that you get is, what if calcium gets deposited? And of course that is known as calcification. Favorite most question of university exam. Short note to aega. You also get a difference between the types of calcification. So now what are the types of calcification? Dystrophic calcification and metastatic calcification. Mein na ek question hai, blame game khelo, keep blaming something, find one thing, blame it, but you can only blame one person at a time. You can't blame 2-3 things at a time, only blame one person. So let me give you an example. Why do you think calcium will deposit? Let's say calcium is depositing in your arteries, in your blood vessels. Why is that happening? दो options हो सकता है. Don't write, अभी just listen and understand. Either the problem is in the artery only has some problem, ma'am, that is why it is attracting so much of calcium. Problem number one. Problem number two is artery is fit and fine. There is no problem in the artery, but the amount of calcium in your blood is so high that it is going and sitting anywhere. वो lungs में भी जा रहा है, it is going in the arteries also, it is going in the veins also, it is going in the kidney also, it is going everywhere in the body. So whom to blame? Either the tissue is to be blamed or the blood calcium levels are to be blamed. So remember, in dystrophic calcification, it's the tissue who is attracting the calcium. Artery में खुद ही problem है, वो कह रहा है calcium please come and sit on me. So what is the problem in the tissue? Either it is a dead tissue, the tissue has died, that will attract a lot of calcium, or it is an old age tissue. Old age tissue means degenerating tissue. Either it is a dead tissue or it is going to be a degenerating tissue. Problem is in the tissue. This means the blood calcium levels are totally normal. Totally normal. What are the normal blood calcium levels? Blood calcium levels are between 9 to 11. That's the normal range. Mostly in all labs, this is what is used. So you will do a blood test of the person and you will see blood mein to normal calcium hai. Still in the arteries, there is so much of calcium deposited. Where is it coming from? That calcium is getting attracted because either the artery is a dead artery, maybe some infection happened, some atherosclerosis happened, artery has died, or it is a degenerating artery because of old age. Do you want to do some examples? Metastatic I will come baad mein. So now I see in DDD, dystrophic calcification, either the tissue is dead or the tissue is degenerating. So let us start. What if some dead parasite comes into your body? Parasite comes, it gets killed. Ma'am, if it is dead, anything dead will attract calcium. If a dead TB bacteria comes into your body, anything that is dead, it will attract calcium. Next, we come to atherosclerosis. Atherosclerosis is what is happening. There is a lot of death and degeneration in the arteries. We know what is atherosclerosis, ma'am. In the blood vessel, there is a lot of death and degeneration. So, which kind of calcification will it get tracked? Dystrophic calcification. यहाँ तक कोई problem आया? See, as till the time ma'am DDT is written, we are champs. D for dead, D for degenerating, D for dystrophic. Dead TB, dystrophic. Dead parasite, dystrophic. Atherosclerosis ka death, dystrophic. Where will you get stuck are these two things, because they don't have the name dead in it. Still, they show you dystrophic calcification. Number one, Monckeberg sclerosis. Do we all know what is the other name? Because other name has the D in it. Then you will know it is dystrophic. Monckeberg sclerosis is also known as CMD, calcific medial degeneration. It is known as CMD. Break the word. Degeneration. Oh, now I know, ma'am. D for degeneration, D for dystrophic calcification. So now I have understood that degeneration is happening. That is why dystrophic calcification will happen. Where is the degeneration happening? The degeneration is happening in medial. Does this remind you of tunica media of where? Guys, where is tunica media present? Tunica media is going to be present in the blood vessel. So, ye kab hoga? This is going to occur in old age to all of us. This is not a disease. I want to tell you now. Monckeberg sclerosis sounds like a very dangerous disease, but it is not a disease. ये disease है ही नहीं. This is a normal thing which will happen to all of us, you and I, when we reach 80 years, 85 years. You know what will happen in our blood vessels? In our blood vessels, a lot of calcium will come. Why? Because with old age, we will degenerate. So does this have any clinical significance? ये disease कोई clinically significant है? Can you do any treatment for it? Is this going to trouble the patient? कोई treatment नहीं है, मैम, ये सबके साथ होना है. This is destined to happen. There is no clinical significance. Let me show you a picture. Number one, this is a blood vessel. How did you identify? Because over here we have a lumen, and a lumen is going to be there in a blood vessel. So I can see a luminal blood vessel. So this innermost layer must be tunica intima. This is tunica media, and bahar wala batao, tunica adventitia. Basic everyone knows, intima, media, adventitia. Now in the tunica media, I saw that there is a lot of blue color calcium that is getting deposited in the tunica media. Repeating, there is a lot of blue color calcium that is getting deposited. Yes, and that is settled. So now read it again, calcific, because ma'am, there is going to be calcium deposition. Medial, where tunica media, degeneration, old age hai, koi problem nahi hai. That is the other name for Monckeberg sclerosis. So the other name is calcific medial degeneration. Degeneration word aaya to dystrophic calcification. Coming to the last one, you need to be living under a rock if you don't know Samoma bodies by the end of second year. Once you learn Samoma bodies in second year, you don't have to revise it ever again, because you will remember it for a lifetime. Koi nahi bhulta Samoma bodies, because so many times the question is asked. What is Samoma body? How does it look like? Samoma body is again calcium, but the calcium is getting deposited in layers like this. Can you see these concentric lamellations that are happening? They are going round and round and round. This is looking exactly like onion peel. So today I am giving you one work in the kitchen. Go to the kitchen, cut an onion. You will see uske andar bahut sare layers hote hain, peels hote hain. So that is what is layer by layer calcium getting deposited. Onion peel appearance or concentric is going to be Samoma body. You know it is dystrophic calcification. Where is it seen? Samoma body is seen in PSM square. Samoma ke naam se it is seen in PSM square, means 2P, 2S, 2M. Let's see. Number one, it is seen in papillary carcinoma. Have you heard of any papillary cancer? I know, ma'am, cancer hota, I know that. Papillary cancer, have you heard of any organ? I'm sure you heard of papillary carcinoma thyroid. Very famous. Itna famous that everyone believes Samoma bodies are only seen in papillary carcinoma thyroid. No, papillary carcinoma of all organs. So if they write, because I will tell you in later months, papillary cancer can occur in all organs. Papillary cancer, likhna mat. Papillary cancer lungs mein hota hai. Papillary cancer endometrium, it is in the ovary, it is in the intestine, small intestine, large intestine, it is in the kidney also, it is in the thyroid also. तो कहाँ तक याद करोगे? Any papillary cancer of any organ will show you Samoma body, not just thyroid. Then come to hormonal diseases. Prolactin increasing, so prolactinoma. Growth hormone increasing, so somatostatinoma. So remember, P for two things, papillary cancer and prolactinoma. Then we come to S for somatostatinoma and S for ovarian tumors. Which ones? serous ovarian tumors. Then you come to two M's. One is the M that you have in the brain. Brain का कौन सा tumor? Meningioma. And one is mesothelioma. Can you tell me which meningioma? तो everyone will know meninges तो brain tumor. Mesothelioma कहाँ का tumor है? Mesothelioma is the tumor of the where? What have I drawn? Don't say tumor of the lungs, because the tumor of the lungs नहीं है. Lung का covering क्या होता है? What is the outer covering of the lung known as? It is pleura. So mesothelioma is a tumor arising in the covering. It is a pleura tumor or a pleural tumor. Repeating this because you learn it once and you have to learn it till the end of your NEET PG and even beyond. So number one, psammoma bodies are seen in PSM square. Papillary carcinoma, prolactinoma, somatostatinoma, serous ovarian tumors, meningioma and mesothelioma. Very good. Dr. Om said that, ma'am, ये जो onion peel था, we have read it in the last to last class also. Remember the black and white onion peel? If you remember, the black and white onion peel was myelin figures, because this is just the start. There are 7 to 8 onion peel appearances in your pathology lectures course. Every time I tell you a new onion peel, I will make you revise the previous onion peels. But the day I teach you the last onion peel, I will make you make a table on it. But that will come many months later. Abhi ke liye 2 onion peels. One you did for myelin figures. The second you have done today for psammoma body. Calcification mein half of it is done. So now I studied that dystrophic calcification is because of dead and degenerating tissues. Ya to tissue mein death ho gaya ya degeneration hua. And that can occur because of all dead things, or it can be seen in Monckeberg sclerosis known as calcific medial degeneration, or it can be seen in the round and round psammoma body. So dystrophic calcification is done. I move on to the other one, metastatic calcification. Ma'am, इसमें tissue की कोई गलती नहीं है. The tissue is not dying, the tissue is not degenerating, no tissue problem. The problem is that the blood calcium levels are very high. There is an increase in the serum calcium or the blood calcium levels, and that is known as metastatic calcification. I told you na, you can blame one person at one time. In dystrophic calcification, whom did you blame? You blamed कि tissue की गलती है. That is why calcification happened. Metastatic calcification में whom are you blaming? That blood calcium levels are very high. So let me draw it so that you get orientation. If this is your blood vessel and you are saying that, ma'am, in the blood there is a lot of calcium that is currently roaming around. So anything, you tell me yes or no, anything that is roaming in the blood कहाँ जाता है? Blood goes to organs. Blood will go to your heart also, blood will go to your brain also, it will go to your lungs, your liver. So can I say now calcium will start going to all the organs? Calcium will go to lungs, to liver, to heart, to brain. जहाँ जहाँ blood जाएगा वहाँ calcium जाएगा. Common sense. Which is the most common organ to get affected? Most common organ affected is going to be the lungs, and that is what they ask you in a case of metastatic calcification. The most common organ affected, lungs. ये तो MCQ हो गया. Short note के लिए you will have to write it. अभी के लिए is this okay कि इसमें किसे blame करा? Because now when I tell you example, you know whom to blame. Blood में calcium बढ़ा, ma'am. That is the problem. So tell me examples of metastatic calcification. Whatever I have written, end result is blood calcium, serum calcium levels have to increase. Let me start with examples. Example number 1, hyperparathyroidism. What is it? Parathyroidism. Parathyroid hormone increases. Go back to your physiology. When parathyroid hormone increases, what increases? Ma'am, there is always an increase in calcium levels, which means which calcification will occur? Metastatic calcification will occur. Can you tell me from physiology why does parathyroid hormone एकदम से क्यों बढ़ गया? Because there is some tumor in the parathyroid gland. Parathyroid adenoma is going to occur. Adenoma means tumor. So if someone has a tumor in the parathyroid gland, तो tumor तो ज़्यादा बनाएगा ना hormone. Tumor will make a lot of hormone. It will make a lot of parathyroid hormone, and that will go and increase the calcium levels. Okay, number 2, ma'am, can cancers also increase calcium? Yes, there are 2 cancers that you have to know. One is kidney cancer and second is breast cancer. Both of them also end up increasing the calcium levels. So when the calcium levels increase, which calcification will occur? Metastatic calcification. Agla, what if someone has vitamin D toxicity? Too much of vitamin D tablets or injections that person ended up taking. We know vitamin D ज़्यादा होगा तो what will get absorbed more? Calcium will increase, and if calcium will increase, which calcification? Metastatic calcification. Next disease, milk alkali syndrome. Milk anyway has a lot of calcium. When someone has milk alkali syndrome, that is going to increase the calcium. Which calcification will occur? Metastatic calcification. You are realizing कि end में calcium has to increase in the blood, then metastatic will occur. Let me look at the next one. Oh, this tumor, ma'am, you just taught us. Multiple myeloma. Can you tell me what was multiple myeloma? It was a tumor of the plasma cells. Multiple myeloma is a cancer of प्लाज्मा सेल्स. अच्छा मैम, ये तो एंटीबॉडी बन रहा था. कैल्शियम कैसे बढ़ेगा इसमें? इसमें तो एंटीबॉडी बढ़ रहा था. बिकॉज मल्टीपल माइलोमा clinically, you know what happens in the patient? The bone breaks. Multiple myeloma has bony lytic lesions because of so many plasma cells. When you read with me later, patient will come to you, patient के x-ray पे you will see all the bones are breaking. When the bone will break, what will come out into the blood? Ma'am, bone is very rich in calcium. If the bone will undergo lysis, bone will break, the calcium levels will increase in the blood. And when calcium increases, what calcification does it cause? Metastatic calcification. How easy? The last one. Have you heard of a disease called sarcoidosis? If you haven't, it is not a disease I can teach you right now. ये एक ऐसी disease है जो हमारे body के multiple organs को affect करती है, from the eyes to the lungs to the lymph nodes to the liver. It is a multi-organ disease. For the time being, I can tell you, this tends to increase calcium, and anything that increases calcium causes metastatic calcification. So overall, कुछ भूल भी जाओ, ma'am, everything has to increase calcium. Only then metastatic calcification can occur. So hyperparathyroidism, cancers, vitamin D, milk, multiple myeloma, and going to be sarcoidosis. Okay, Dr. Anmol, I have not seen that. In case you sent me on Telegram, I will look into it. Also, let me know your username, because Telegram pe DMs are a total mess. So many spam messages come. So I won't be able to trace it down. Just let me know your username so that I can then trace you down and see your paper A that you sent me, right? Okay, so finally done. Okay, there was a question related to it. If you have a doubt, then you can let me know. I can put it down over here also. Okay, so you've got it. Perfect. We'll let's attempt, guys. A good way of attempting a question. So Dr. Anmol has put up a question on dystrophic calcification is seen in uterine median नहीं होगा, medial calcification होगा, I think. Calcified neurocysticercosis, renal calcinosis, or calcinosis cutis. So was this a multiple choice question, Dr. Anmol, or was it a single best answer? Because there is a multiple choice that I can see over here, or multiple options correct. If it is a single one, then we'll have to pick up the single best answer out of these. That is what we do in MCQs. कई बार दो answers ठीक लगते हैं, but if the examiner is asking for the single best, then we have to pick that up. So in case this was a multiple choice, then I would say it is going to be A as well as B. But if they say that this is to do with a single best answer, for that you will have to tell me वो uterine medial calcification था, or have you written median? वो median ही था, or is that a typing mistake that you've done? Medial calcification. What is it that you have? अगर medial है, for example, till that, because I know there's a lag, तो A and B दोनों आंसर्स बनते हैं. Both of them can show you dystrophic calcification. But in case in the exam they tell you that single best आपको select करना है, then in that situation calcified neurocysticercosis is going to be the best answer, because neurocysticercosis is a parasite. Parasite, I just told you, na, whenever there is a dead parasite, then that is the situation in which calcium gets deposited. Whereas medial calcification or median calcification, that can occur because of other reasons also. That can be associated with some blood calcium levels, but parasite तो कभी भी blood calcium levels नहीं increase करता, तो neurocysticercosis being calcified will be coming under dystrophic calcification. Median ही था, then तो I'm all the more sure, then calcified neurocysticercosis will be the answer only. ठीक है, because any dead parasite, with neurocysticercosis अभी माइक्रो में अगर नहीं पढ़ा, it is Taenia solium. Taenia solium is a parasite, and any dead parasite will cause dystrophic calcification. Okay, coming back, so that's a good way. We've done it. We've done the difference also. Difference पूछा जाएगा तो मैम हम पहले tissue and blood का बताएंगे, then सारे dystrophic के examples लिखेंगे that we studied over here, and then सारे metastatic के examples लिखेंगे that we studied over here. But we forgotten something. We have forgotten the stain. सबका special stain हम याद कर रहे थे मैम. Then the topic will get over. What is the special stain for calcium? So now for that, I will have to write the word calcium because that will give me a lot of help. There are 3 special stains for calcium. Number 1 is going to be von Cossa stain, and I will show you the picture also, which I have highlighted above. Von Cossa stain gives a black color to calcium. So when I zoom into the first picture, I have highlighted already for all of you that can you see that von Cossa stain is getting this blackish color everywhere. Calcium becomes black in color. Coming to the next stain, the next one, and mnemonic I will give you in a while, okay? The next stain is going to be the alizarin red stain. I mean, I'm not zooming in because it's very obvious that the color that is going to come to calcium is going to be a red color, which you can see everywhere over here. This stain is very important because it is used for staining minute amounts of calcium. What does that mean? You will say, ma'am, Abhina, it has been only 5 days this person is having calcification. He has very little calcification in his tissues. Only few dots, thoda speckles hai calcification, sprinkle hua hai calcification. That little calcium can any stain pick up? Yes. Alizarin red can pick up the smallest amount of calcium. How I have learned it? Alizarin can pick up zara sa calcium. Alizarin red can pick up minute, chota sa, zara sa calcium. Coming to the third stain, and that is going to be the calcine stain, for which you don't have to know the color, so don't worry. Now how I have learned it is K for calcium, K for Cossa. Cossa gives it a kala color. Will you remember? K calcium, K Cossa, and Cossa is going to give it a black color, or you can learn it as a kala color. Yaad rahega? Calcium, Cossa, kala. Okay. The next 2 alphabets are going to be Al. So that tells me alizarin red zara sa calcium, alizarin red. And when I read it fully, that is calcium, it will always give me the word calcine. हो गए ना तीनों याद? K calcium, K Cossa, K kala. Al for alizarin red zara sa calcium, and calcium, calcine. All the 3 stains are done. So now if I ask you some more questions, that is going to be question number 1. Can you answer it? Let's take a one-liner test of yours. What is the stain for minute amounts of calcium? For zara sa calcium, tell me, von Cossa, alizarin or calcine? For zara sa calcium, perfect, alizarin red. ये question तो हमें आता था, कुछ नया बताओ मैम. Next question. If you have to differentiate osteoid from mineralized bone, ये क्या question है? Why is it so dangerous? Because I see I'm talking about bone. Bone has calcium. So you're talking about calcium only. There are, when I will teach you later on in ortho also, you will study with me also in bone path, you will study. जब bone बनना शुरू होता है, starting में, it's not कि एकदम से you get a full proper bone, ऐसा नहीं होता. Starting में it is very thin pink color of bone that is formed. That thin pinkish color is just osteoid. धीरे that bone becomes very strong. That is known as mineralized bone. So if you have to compare immature and mature bone जो अभी 2-3 days old है, बनना शुरू हुआ, versus the bone that is properly formed, there is a stain which is known as the Azan stain. Azan stain is the stain to differentiate baby bone from adult bone. That is how you can learn it. Baby bone osteoid from adult bone, that is mineralized bone, you have the Azan stain. Finally, coming to the next one. Chalo, you say calcium is getting deposited in the lungs, calcium is getting deposited in the artery, calcium is getting deposited in the brain. What is the site? First site of calcium deposition, kahan deposit hota hai? Is it getting deposited in the mitochondria, in the ribosome, in the endoplasmic reticulum, in the lysosome? So the first stage or site of deposition of calcium will always be mitochondria, but rule hai to exception hoga. In the kidney that does not happen. Kidney में calcium सबसे पहले, it does not go to the mitochondria, it goes to the basement membrane. And now I want to remind you of something very important. I had taught you in last month in the first class of pathology, first class of cell injury, that hero of this chapter is mitochondria. सब कुछ mitochondria में ही problematic होगा. And what is that going to be over here? So you realized that, ma'am, let me start from day 1. What is the first organelle in cell injury to get damaged? सबसे पहला organelle which shows a damage in cell injury, mitochondria, number 1. What was the main organelle for apoptosis? Ma'am, the hero of apoptosis, or the question was, who plays a pivotal role in apoptosis? Mitochondria. Question number 3, where does calcium go and sit first or get deposited first? Mitochondria. So ultimately in chapter 1, when you forget something, answer is always mitochondria. That is how you learn it. But in the kidney, calcium goes and sits first in the basement membrane. So finally calcification is done, but your story is not done. I've got a small test for all of you, MCQs, फिर अगले topic पे चलेंगे. This is what you will fill in the blank for me. Let's quickly start. What you have to tell me? I've written all this in front of you. You just tell me the name of the stain. सबसे पहले मैम मेलेनिन के लिए 3-4 स्टेन थे. First you told us M for melanin, M for Mason Fontana. Remember this? M for melanin, M for Mason Fontana. Then the mole wala, that is what you told us was the small stain. Then you told us some immunohistochemistry like HMB45, even melan A was there, S100. Then you told us one enzyme, and enzyme was dopa oxidase. Next one, lipofuscin. Remember old age pigment, 83-year-old man, perinuclear pigment, lipo and fuscin. ऐसे split करा था. For lipo you had taught us oil red O, and for fuscin you had taught us acid fast. Coming to hemosiderin, sidro means iron. Ma'am, for iron you had told us something blue color. So the name of the stain was Pearls or Prussian blue stain. Coming to the next, copper. How can you forget RRR? Copper ends with R, stains begin with R. The name of the two stains were rhodanine. I hope you're writing rhodanine, not rhodamine. Rhodamine MTB के लिए था. So rhodanine and rubianic acid. Coming to glycogen. Glycogen के लिए तो remember periodic, past positive diastase sensitive. Coming to fat or lipid, I've already taught you. Red color का है तो oil red O, black color का है तो Sudan black B, even Sudan 4 was there which was giving an orange color. Coming to the last one which I just now taught you, calcium का calcium से आएगा, that is number 1 it is going to be K calcium, K kosa, K kala color. The next two is going to be AL for alizarin, red S, and lastly calcium, calcine. All this will be your final summary. This you will revise on the last day when you have to write a short note, but revision करके जाना है jaldi. This is going to be your thing. So now I quickly want to ask you a question, and from that I will get to know whether you were listening or not. Lengthy question, but let's see if you have been attentive. Elderly female patient presented to the OPD with presence of a lump in her right breast. Don't be in a hurry, please मेरे साथ पढ़ो as a clinical question. Right breast lump in an elderly female. Stop here. What is your clinical knowledge that tells you? Old woman, elderly woman, breast lump. Do we all think of breast cancer? Of course. The lump is measuring 5 by 4 centimeters. The lump is firm to hard lump further, telling you clinical side. When you touch any lump in the body and it is very hard like stone, you always think of cancer. It was hard. The lymph nodes were also palpable. मतलब cancer फैल चुका है. Cancer has spread. It has gone to the lymph nodes also. And the lymph node is showing tumor deposit. Examiner has told you cancer है, पक्का है. There is deposition of an amorphous material positive for von Cossa. What is positive for von Cossa? Calcium is also getting deposited. They said what is incorrect about this? They are asking you what is wrong about calcium. Tell me a true and false. Number 1, grossly calcium देखने में, if you see calcium with your eyes, does it look chalky white in color? Yes, ma'am. Does von Cossa give kala color to calcium, black color to calcium? Yes, ma'am. Does the stain for picking up minute quantities of calcium, alizarin red S, zara sa calcium, alizarin red S? Yes, ma'am. First site of deposition of calcium, is it endoplasmic reticulum? No, you cannot miss the hero of the story. The first site of calcification is mitochondria. They asked you the wrong statement. Option D is the wrong statement. पता लग गया how you don't have to be in a hurry to attempt MCQs. Simple एक line पढ़ो, you will come to your answer. Perfect. Moving on to the next question that you have over here. Incorrect about the pigment shown. पहले तो you guys tell me what pigment has been shown over here. I can see there is a blue color nucleus over here, and then I can see there is a pigment which is brown in color. Whenever they say perinuclear pigment, what comes to your mind? It has to be a case of lipofuscin. So now let me start reading. Is lipofuscin yellow brown in color? ये तो दिख ही रहा है. Is it going to be lipo? Is it because of lipid peroxidation? That is also correct. Lipo, is it positive for oil red O? That is also correct. Is it seen in infants? No, ma'am. You told us lipofuscin was old age pigment. It was also known as senile pigment. So over here also option D is the wrong one, and that is the answer over here. Come on, one more question. Which of the following is used best suited for the diagnosis of glycogen? Simple. ऐसे questions can come in your university exam also. Simple one-liner questions. What is for use of glycogen? तो ग्लाइकोजन के लिए यू आर गोइंग टू हैव पास पॉजिटिव, टू बी वेरी प्रिसाइज पास पॉजिटिव डायस्टेज सेंसिटिव. Perfect. बाकी सब भी बता दो. Oil red O is for what? Oil red O is for fat. Then pearls is for what? It is for anything to do with iron, or you can call it as hemosiderin. Congo red I have not taught you right now. वो बाद में पढ़ोगे. You will study something in chapter 5 and that is going to be amyloid. And amyloid is positive for Congo red. अभी भूल जाओ, you will anyway study it later on. So is this okay with everyone? We have finished one very, very big topic and now we are left with two small topics for today. What are those two small topics? Number one, so because I know when we come to this stage, all of you, thank you, sorry, वो thank you सिर्फ उस topic के लिए था. It's not thank you for the day. Those two small topics that you have are going to be one, autophagy, on which you are getting a short note, and second is going to be free radical injury, again on which you are getting a short note. And इसी free radical injury के साथ you will also understand how we are becoming so old because of free radical injury, which is a separate short note. So 2 or 3 topics are left and I think we have time in hand. So should we make a, again, time boxing शुरू करें? Like I teach you every time, whatever time you give to your mind will finish it in that much. So let's see what's it. 6:40. Our class is till 7:30. We have approximately 50 minutes in which we have to finish it. So should we start in that time boxing technique कि पहले we will try and level best that in the next 20 minutes we will first finish off autophagy and then we will go to the other topic. शुरू करें, 20 minute timer on करें and by 7 o'clock should we wrap up short note of autophagy, which I think will come in your exam now. Because you are which edition of Robbins are you reading? 10th edition, and 10th edition में ये add हुआ था because in the 9th edition so many details of autophagy were not there. So because it has been added, they will ask you questions more. तो शुरू करते हैं. Why has autophagy become so popular? Why was it added? Because in 2016 so much got to be known about autophagy. That is because of this Japanese scientist. The Japanese scientist's name was Sir Yoshinori Ohsumi, and he received a Nobel Prize also because he told us so much of information about autophagy. So now let me ask you, what is autophagy for you guys? Auto means what? Auto means self, and phagy means what? It means eating. What is autophagy? Autophagy is self-eating. What is it also known as? I mean, just imagine, forget all this. Common sense से ज़्यादा समझ आता है ना. तो think of nowadays, you must have heard of so many diets which are becoming very famous. Some people are doing keto diet. Some people are doing intermittent fasting. Some people are doing 1 meal a day, which is known as OMAD diet. इतने सारे डाइट्स हैं. बेसिकली द कॉन्सेप्ट ऑफ अ डाइट इज पुट योर सेल्फ इन कैलोरी रिस्ट्रिक्शन. अपना कैलोरीज कम कर दो, यू विल एंड अप लूजिंग वेट. बेसिक प्रोटोकॉल. सो व्हेन यू डिक्रीज योर कैलोरीज, your body is not getting the if your body has to survive on say 1800 calories but you are consuming 1200 1000, where what will the body do? Body को तो 1800 चाहिए ना for day to day functioning. Body is not getting, so the body can't afford to die. कि अच्छा 5 days this person did not eat food in a good amount, or he is on some crash diet, so I should die. Your body will adjust, your body will adapt, it will find other ways. What will your body do? It will start eating its own self. कि अच्छा चलो अभी this person is not eating food, he has some exam coming up, or he's not been eating food since 1 month because he's on some diet, so let me just eat my own mitochondria and get little energy out of it. I will be able to survive. Let me eat my own ribosome and get energy out of it. I will be able to survive. So self-eating is not a disease. Self-eating is basically done for survival. That is what you call as autophagy. So can I say in animal language, can I call it cannibalism? This is also known as cell cannibalism because I am eating my own self. So in animals this is known as cannibalism. Cell suicide, okay, not a very good term to use. You can use it, but as a pathologist I would not recommend it because kahin agle chapter mein I will teach you cell suicide also, then you will get confused. So I would suggest limit yourself to cell cannibalism and self eating, ठीक है? Because ऐसा नहीं है that the entire cell dies off and it has just committed suicide. Only a part of the cell is eaten. Let's say mitochondria is eaten. Only mitochondria, one mitochondria goes away, your cell won't die. 2 ribosomes go away, your cell won't die. So it is little parts are being eaten. Let's understand better. When does this happen? So autophagy is going to be seen in, as I told you, number 1, malnutrition. Because if you're not eating food, then your body will have to adjust, will have to survive. Second, it is seen in old age. Old age means senile individuals. Because in old age also you must have seen that people stop eating. Their hunger goes down, appetite कम हो जाता है, वो खाना नहीं खाते, they don't eat food. So body might survive with autophagy. But ये तो मैम ठीक है, समझ में आया. Now they are saying that autophagy is the reason behind neurodegenerative conditions. Do you know any neurodegenerative disease? I'm sure you've heard of it. Alzheimer's disease. They are saying कि जो memory loss होता है Alzheimer's disease में, that is because we are eating our own brain. That is why memory loss is happening. This is a kind of neurodegenerative disease. डिमेंशिया होता है, मेमोरी लॉस होता है बिकॉज ऑफ ऑटोफेजी. इवन इन पार्किंसंस दे आर सेइंग, पार्किंसन डिजीज में, रिमेंबर आई टोल्ड यू पार्किंसन डिजीज वाज बिकॉज वो डोपामिनर्जिक न्यूरॉन्स वर गोइंग डाउन. सो दे आर सेइंग ऑल दैट इज हैपनिंग बिकॉज वी आर ईटिंग आवर ओन सेल्स, वी आर अंडरगोइंग ऑटोफेजी. इज दैट ओके विद एवरीवन? सो नाउ दिस इज व्हाट यू नीड टू नो. नाउ इट्स इंटरेस्टिंग. And Sir Yoshinori Osumi told us about this. That is why he got a Nobel Prize. So let's understand what was added in Robbins. The types of autophagy have been added in Robbins. How do we do autophagy? पहले नाम पढ़ लो. मैक्रो ऑटोफेजी मतलब कोई बिग पाथवे होगा. Micro autophagy means छोटा pathway, micro. Something called CMA or chaperone mediated autophagy, and something called mitophagy. If you have no idea about it, out of these four, which one do you think we are eating the mitochondria in? किस में हम mitochondria खा रहे हैं? तो मैम again, easiest one खत्म, finished. Mitophagy is what? We are eating mitochondria. How easy. My main focus is going to be on these two, macro autophagy and micro autophagy. For that, before I start, I want to tell you one story which is the most relatable story of your life. वो याद रहेगा ना, macro versus micro हमेशा याद रहेगा. Autophagy is eating. You are the same person, but if I put you in two situations na, you will eat differently. If I put you in your house, you will be treated so well. Your mother or your parents or your siblings or someone will give you food. कैसे? Plate में खाना, fresh home cooked food will be given to you. They will put it in a plate, in a bowl with a spoon. अच्छे से you will eat. That is how you were treated at home. So at home, what you're treated is a macro way because you've come back from your hostel or you've come back after studying. So everyone is trying to give you the best treatment. Versus when you are in your hostel you have to wash your utensils yourself. खुद से बर्तन धोना है मतलब मैम we are not going to use them only. Why should I use them? I will order from outside. In that takeaway box, pizza वाले box में I will eat the food. I will throw the pizza box. That's it. We will not take out any plates and bowls and spoons at all क्योंकि धोना नहीं है. So what you do over there is micro autophagy. See, you are the same person, but I put you in two different situations. You act differently. घर पे you eat food macro करके plate में सजा के, that is macro. Hostel में you eat food ऐसे जो भी मिला वो खा लिया, that is known as micro. So let me start with macro autophagy and I will write a small little home in front of it so that you remember कि अच्छा home में जैसे खाना मिलता है plate में सजा के. So now what I see over here is these are the things that you want to eat. S that I have written over here is this red color thing. ये आप खाना चाहते हो. This could be a mitochondria, this could be a ribosome, this could be a endoplasmic reticulum. This is what you want to eat. तो कैसे करो? घर पे हो मैम, घर पे ऐसे ही थोड़ी ना उठा के खा लेंगे. If I'm at home, I will have to put that in a proper plate. So what did you do? Whatever you wanted to eat, you made a proper plate around it. पहले you started making a plate, then you made a bigger plate, and finally you made a complete plate. तो पहले खाने को plate में रखा, then you have eaten it. That is macro autophagy. So please remember, the cell, number one, the cell makes an entire membrane called phagophore. Can you see what is made and the first thing? Ma'am, plate बनना शुरू हुआ. That is going to be phagophore. Okay. Then can you see the plate has become bigger? So that is known as pre-autophagosome. It is written as APS, pre-autophagosome. Okay, then ma'am पूरा plate बन गया. That is known as autophagosome. So the next thing that comes is autophagosome. कैसे बना? छोटा plate is known as phagophore. Then little plate becomes bigger, pre-APS, and then full plate is formed, that is APS. Ma'am, now the food is ready to be eaten because they have put it in a plate. Now I will go and I will eat the food. So to eat the food, this autophagosome has to combine. Can you see this autophagosome has to combine with something known as lysosome क्योंकि खाना तो हमेशा lysosome has a lot of enzymes. Ma'am, lysosomal enzymes will go and they will eat the food with me and then I will get all the energy that I needed. So they will ask you, put it in step by step, or they will not ask you, you will get a short note. So you will have to write, first I make a chota plate phagophore, then I make a bigger plate called pre-APS, then I make a full plate called APS. Finally, I fuse it with lysosome and the food has been eaten, energy मिल गया. But ये कौन बना रहा है? This is made by, number one, phagophore is made by the first complex called ULK1 complex. Then pre-APS is made by Becklin 1 and next APS is made by LC3. How I have learnt it, because I know it's not an easy one. ULK, for example, I'll write it over here. ULK followed by Becklin followed by LC. Ma'am, इस order को कैसे याद करें? U for Uno. Uno is always number 1. B for Becklin, that is by मतलब second number पे आएगा, and LC3 third number पे आएगा. तो simple, Uno वाला molecule first आएगा, फिर by Becklin वाला molecule by मतलब second आएगा, and LC3 वाला molecule is going to come as the third one. In fact, LC3 का full form please जान लो, that is known as light chain 3. Only for LC3 you have to know. Will you be able to put it in the correct order? पहले Uno, then Becklin, then LC3. मतलब ULK1, Becklin and LC3. These are the three things. Finally autophagy हो गया मैम, and that is done. Are we okay with this? Because now I will tell you the tough part. ये तो आपने समझ लिया. Now I will tell you the story of, do you think you need to do all this if you have a lot of food in your body? If you are eating बिल्कुल ऐसे pizza, pasta, good nutrition, macronutrients, micronutrients, 20 to 100 kilocalorie diet I'm having every day, ma'am, with vitamins and supplements. Do you think your body needs to do all this? No. So can I say, when you are well fed, you are getting good food, you are at home, you are enjoying, your mother is cooking tasty food for you, at that time your body says ये सब नहीं करना, ज़रूरत नहीं है. Your body wants to stop all this. How does your body stop this? How does your body get a signal? Because whenever you are well fed, one molecule increases in your body called mTOR. So whenever we eat a lot of food, what increases in my body? mTOR increases in my body. And because of this mTOR, finally the mTOR goes and says, Abhi, I don't need you. When I need you, I will let you know. So can I say, when a person is fasting, like if you ever decide I will go on a 21-day fast, what will decrease in your body? mTOR will decrease in your body, and then this signal will go to ULK1 that khana nahi aa raha, please survive, please start autophagy. So can I say mTOR and this pathway goes opposite? When you are eating well, mTOR increases. mTOR increase हुआ मतलब autophagy decreases. If you are not eating, then mTOR goes down. mTOR goes down means autophagy increases. So can I say mTOR and autophagy go ulta? mTOR ऊपर गया, autophagy down. mTOR नीचे गया, autophagy up. Are we okay with this? Macro autophagy, very complicated ma'am, because घर पे तो proper plate बना के खाना खाना था. Whereas now let's go to micro autophagy. In front of micro autophagy, I will say hostile. Hostile means no utensils, koi plate nahi, chammach nahi. Pick up the food from the pizza box, put it into your mouth. So for example, if this is a lysosome, it wants to eat something, it will just pick it up and put it in the mouth. How? By endocytosis. ये जो भी है, ribosome, endoplasmic reticulum, mitochondria, जो भी है, lysosome says कुछ नहीं, I'm going to pick it up, put it in my mouth, खत्म. So it does endocytosis and the story is done. Microautophagy is so simple. How will you write it in the exam? It is going to be degradation by the lysosomes. कैसे करा? By making a plate or by endocytosis? It is degradation by lysosomes by a process of endocytosis. That's how you write it. But किसी को समझ नहीं आता exam में. Till the time you don't make this diagram that there is a lysosome which is going to eat it by endocytosis, this will get you marks. Before I move on to the next, can you give me a understanding? समझ में आया? नहीं आया? Tell me, this is a cell, it wants to eat अपना अपना mitochondria, अपना अपना कुछ. It makes a plate like phagophore, phagosome, then it goes and eats it. तो ये वाला pathway कौन सा लग रहा है? Macro autophagy और micro autophagy? What should I write it? It is macro or micro autophagy? मैम ऐसा प्लेट बन रहा है प्रॉपर, तो फिर तो आई थिंक दिस इज गोइंग टू बी मैक्रो ऑटोफेजी. ऑन द अदर हैंड, ऐसे खाना उठा के खा लिया, just picked it up and ate it, ma'am, this I think is the hostile wala method. That is going to be micro autophagy. Will you be able to recognize it? So these two are done. Okay, macro is done, micro is done. एक छोटा वाला और कर लेते हैं, mitophagy, because mito में तो I know ना कि mitochondria खाया जाएगा. So now look at this, everything that I see is the same. Only thing is, what am I eating is now a mitochondria. Now I want to ask you, the mitophagy is, I will write some things, you will fill in the blanks for me. Mitophagy is eating of what? Come on guys, mitophagy is the eating of, ma'am, common sense, it's the eating of mitochondria. Perfect. It is the eating of mitochondria. Fine. Next, what process is it? ये कैसा लग रहा है? इसमें मैम दिस इज द माइटोकॉन्ड्रिया, तो पहले देयर इज अ फैगोफोर फॉर्मेशन, प्लेट बनाया, देन अ फुल प्लेट इज फॉर्म्ड अराउंड इट, देन फुल प्लेट इज अगेन फॉर्म्ड. इज इट सिमिलर टू मैक्रो ऑटोफेजी और माइक्रो ऑटोफेजी? इट इज सिमिलर टू दिस. आई वांट एज एन आंसर फ्रॉम यू. इट इज सिमिलर टू विच ऑटोफेजी? बिकॉज पूरा प्लेट बना के खाया जा रहा है. सो दिस इज सिमिलर टू मैक्रो ऑटोफेजी बिकॉज दे आर मेकिंग एन entire plate. Yes, everyone, are we okay with this? I need a yes or no. We are making an entire plate and eating the mitochondria. Matlab this is a type of macroautophagy. Very good, understood. Third thing, there are so many mitochondria in my body. So many mitochondria. How do you know kaun sa wala khana hai? Which mitochondria do you have to eat? Body knows. Tell me, if you have one mitochondria which is at the peak of its energy, it has lot of ATP, it is doing the best work, versus a mitochondria which has become a little old. It has ATP, but it has become a little old. For your survival, what will you do? You will go and eat that mitochondria which is doing so much of work for your body, or you will say, I just need ATP. So let me eat the damaged mitochondria which is anyway not doing much work, but it is making the ATP, which seems like logical. So you will say that I am going to actually do eating of damaged mitochondria because I just need energy na. तो वो तो damaged mitochondria के साथ also I will get. I am going to just eat the old mitochondria or the damaged mitochondria. How do we identify कि ये mitochondria young है, ये mitochondria old है? Any mitochondria that expresses two proteins, that is pink and parkin. So now this is your ID card. Kya acha, you have pink and parkin, you are old, let me eat you. You have pink and parkin, you are old, let me eat you. So they express two proteins called the pink and parkin proteins. If they are expressing pink and parkin, this means they are old mitochondria, you can eat them and the story is done. So I realized that you will make this diagram, you will make everything of macroautophagy. Only thing is that in the center, what will you do? You will make a mitochondria. Baki story same. So can you fill in the blanks? सबसे पहले क्या बना होगा? आउट ऑफ ULK, बेक्लिन एंड LC3, मैम सबसे पहले ULK1 ने हेल्प करा होगा. आफ्टर दैट बेक्लिन मस्ट हैव हेल्प्ड. आफ्टर दैट LC3 मस्ट हैव हेल्प्ड. जैसा जैसा पढ़ा था वो मैक्रो ऑटोफेजी, एवरीथिंग इज द सेम. ओनली थिंग इज दैट इन द सेंटर यू हैव गॉट अ माइटोकॉन्ड्रिया. दैट शुड बी एन ओल्ड माइटोकॉन्ड्रिया. इट इज आइडेंटिफाइड बिकॉज इट एक्सप्रेसेस two proteins called pink and parkin. Are we okay with this? Because now we are left with the last one, and that is CMA. This is the one which is different. Chaperone mediated autophagy. This could come as a separate short note also. For that you are going to tell me what is chaperone. पहले तो ये मतलब बताओ ना, what is chaperone? I'll give you an example also of a chaperone. Heat shock protein, HSP is a chaperone. पर होता क्या है मैम? example तो ठीक है, heat shock protein is going to be a chaperone. बताओ, basic biochemistry, cell biology, what is the chaperone? Chaperone is something that see, everyone can make mistakes. ये सब भूल जाओ. In your body, have you studied in anatomy and in biochem कि proteins को fold होना होता है? It's not that this is a protein, बन गया खत्म. Protein has to fold properly, then only a protein can work. Any protein in your body, rule number 1, when a protein is formed, we are going to fold it properly. If it folds properly, it will work. If it doesn't fold properly, it will not work. Sometimes we make mistakes. Galti se ma'am, it's like folding a t-shirt. Sometimes you can fold it very well and your mother is very happy. Sometimes you fold it like in your hostel. You just make a big crumbled thing out of it. ऐसा एक बना के गोल सा, you just throw it in your cupboard. That is misfolding. That is what you will be caught later on by your mother and she will scold you. तो वही हुआ. हमारे कुछ proteins हैं which ended up acting smart and they said कैसे भी fold हो जाते हैं. They said let us become misfolded proteins. They are useless for my body. They will create problems. I have to correct them. Who are the people who are going to correct the misfolding proteins? Like your mother comes and tells you cupboard कितना गंदा है, your clothes are not folded properly, ठीक कर लो. So that mother who is going to come and correct the misfolded protein is a chaperone. Chaperone, like heat shock protein, it corrects the misfolded protein. उसका काम है जैसा भी fold करा उसे proper fold करके ठीक कर दो. That is chaperone. If one thing, chaperone को आपने काम करने दिया, if you let the chaperone work, it will correct the misfolded protein and the body is happy. If you don't let the chaperone work, you say stop, no, you can't work, you can't touch my cupboard, you can't correct my clothes, you can't properly fold, then what is the option? You want to keep a misfolded protein? No. Then your body will do something कि कोई और तरीके से, plan B, कि अच्छा you're not letting chaperone work, let me remove this by some other method, and that is what I will teach you. So now listen to me properly. Chaperone mediated autophagy says, look at this protein, ये वो protein है जो कैसा भी fold हो गया, misfolded protein. Who will come to correct it? Ma'am, some chaperone will come to correct it, like heat shock protein, HSP, because this was misfolded. HSP said, like a school teacher, like a parent, it came, it said, इसको ठीक ठीक fold कर देते हैं. But ये तो सुन ही नहीं रहा. This misfolded protein is still remaining like this. It says, I am not going to correct, I am not going to get folded. Now you give me a yes or no. This protein is not listening to your HSP. Do you want to keep it in your body? This is like a naughty student. Principal, the teacher has come, class teacher comes, says, please don't be naughty, do your homework, don't trouble everyone. उसने अपना समझाया, but the student is not ready to listen only. Now what will the teacher do? School में क्या होता था? Principal ma'am के पास चलो. So now the heat shock protein tells this protein, misfolded one, कि चलो principal ma'am के पास चलो, and that principal ma'am is a lysosome, because now he is being taken to the principal, that get him out of school, chuck him out of school, क्योंकि ये बच्चा सुनता नहीं है. That is what you're doing. So now you have to enter the principal room. Who is entering the principal room? This is the misfolded protein, number one. And who is taking him to the principal? Ma'am, the heat shock protein, who is the teacher. To enter a principal room, ऐसे थोड़ी, you just like CID दया, you bang open the door and you enter. Ma'am, principal room के अंदर एक door होगा, that door you will open, you will take permission, then you will go in. Same way, to enter into the lysosome, you have a door over here. And what is that door? It is known as LAMP 2A. LAMP is what? किसका door है? Lysosome का door है, ma'am. So lysosome associated membrane protein. Lysosome associated membrane protein. Ye door you have to open. When you will open this door, yes, now that student, misfolded protein, and the teacher, heat shock protein, they have gone inside the principal room, and what will principal say? Nahi sun raha bachcha, chuck him out of school. What has the lysosome done? Lysosome said, chuck the student out of school. The protein has been degraded. So whenever there is a naughty protein in your body, a misfolded protein, step number one, heat shock protein या chaperone आएगा, it will try to correct it, समझाने की कोशिश करेगा. If it does not understand, you take him to the lysosome, and then the lysosome or the principal is going to break that protein. The only question that in MCQs you get is, in which pathway is LAMP 2A used? Which autophagy uses LAMP 2A? Chaperone mediated autophagy. So are we clear with all the 4 types of autophagy that we had to know? पहले, if I have to give you a summary. Number one, macroautophagy is जिसके अंदर you were making that big phagophore, phagozo. Microautophagy जिसमें you just put food into your mouth, endocytosis, that's it. Mitophagy is eating mitochondria. It's a type of what? We will link it now. It's a type of macroautophagy. And chaperone mediated autophagy is the one in which HSP, heat shock protein, is being used. I know it's not easy, but I hope you have understood the 4 mechanisms, because nothing is complete without some note questions. Which of them is the marker of autophagy? Ma'am, 3 proteins पढ़े थे. एक था वो UNO वाला ULK, second is Becklin, third is LC3. LC3 or light chain 3 is the marker of autophagy. Question number 1. ये आपको short note में भी लिखना है, and MCQs तो पूछा ही जाएगा. Once you are done with the entire short note, your last 3 lines should be this. This will tell the examiner that you know the intricate details. बिल्कुल end तक आपने topic को पढ़ा है. Marker of autophagy, repeat with me, LC3. What is the most important gene for autophagy? So you will say, wait, God has given us genes for autophagy. Yes, God knew कि कभी कभी इनको ऐसा अटैक आएगा कि oh, new year, new me, new resolution, I have to lose weight. So they will go for this 1 month diet, and after that 11 months they will be eating cheesecake. So God knew that they will go on fasting, they will go on diets. So कभी कभी तो autophagy will be needed. So God gave you genes for autophagy. Those genes go by the name of ATG. Simple. Autophagy के लिए कौन सा जीन दिया भगवान ने? ATG. ATG 1, 2, 3, 4, 10, 12, 16, 18 ऐसे बहुत सारे genes हैं. The most important gene for autophagy that we have is ATG1. The most important gene for autophagy that we have is going to be ATG1. Okay, so now that means if God has given me genes, those genes will undergo mutations, and then patient will end up with diseases. So let's assume someone has ATG 5 gene mutation. I told you ना ATG के बहुत सारे numbers हैं, 1, 2, 5, 10, 12, 15, 18 ऐसे बहुत सारे numbers. If ATG 5 gene is undergoing a mutation, the person is going to have an increased risk of TB, and you'll be like, Anyway, every person in our country is at a risk of TB, is going to have TB. Let's assume sabhi ko TB hota hai, right? But if someone has ATG5 gene mutation, that person is at a further increased risk of TB. That is the first thing. If someone has ATG16L gene mutation, that person is at an increased risk of IBD. Do we know what is IBD? अभी GIT पढ़ा नहीं, तो अभी के लिए you will have to just go through this name one. It is known as inflammatory bowel disease. Inflammatory bowel disease. So inflammatory bowel disease is, you can now know कि क्या disease है, कि मैम ये एक GIT का intestine का disease होता है, that happens because of ATG16L. These are the 3 MCQs also. This is what? This is the dabba you will make as clinical correlation in your short note. Examiner will know, okay, they have read autophagy ka mechanism and they know patient also. If ATG5 is mutated, patient will have TB. If ATG16L is mutated, patient will have IBD, that is inflammatory bowel disease. Are we okay with the full short note? Pura short note ka material ready for autophagy, from the scientist to the meaning, to the types, to the mechanism, to clinical correlation. Sara short note aapka ready. Can I move on to the last topic? And wow, it's 7 o'clock. We have exactly finished it in 20 minutes. So now we have 30 minutes left for our last topic. What is aging and free radical injury? We are going exactly on point today. Are you ready with the next and the last topic, not just of this class, of this chapter also, guys? Aging, ये सबसे interesting. I've kept the best for the last. Why are we becoming buddha? Why are we becoming old? Apart from because we have joined, I mean, I shouldn't include we in this. You are not. You are very, very young. Second prof is like the youth at its peak, so I would not include you. But people like me who are on the other side of MBBS and MD now, why are we becoming old? One, we have become old because we had to give so many exams and study so much in our life and continue to study now. So one reason is that. But medicos ke alawa, why is everyone, someone asks you, why are we becoming old? Why couldn't we be like those babas who live in the Himalayas and they live for 120 years and they don't get old only? So now why are we normal human beings becoming old? Number one, the most common cause as to why we are aging is thanks to the environment, and that is free radical injury. The free radical injury is the most common cause. पढ़ेंगे थोड़ी देर में. Second most common cause, this is where I want to start with, that is telomere shortening. We are becoming old because of a chromosome problem. Did you know all of us have a problem? Our chromosomes will become old and that is why we will become old. I will teach you. Number 3, we are becoming old because आजकल का सबसे major problem, dietary issues. Our body is going into insulin resistance as we will, our cells till like say 20, 30, 40 years of age, your cells are saying insulin hai, chalo let insulin come, let insulin act on me, okay. After 40, your says to hell with insulin, I will not let insulin work at all. Insulin resistance, and that is why we are becoming old. And lastly, our DNA stops working. DNA repair mechanism says, जो भी problem है मैं ठीक नहीं करूँगा. DNA खराब होता है, होने दो. So DNA repair defect is what is making us old. The 4 reasons of why we are becoming old. If someone ever non-medico asks you, सबसे पहले you will say, thank the pollution around you. Free radical बन रहा है, that is why you are becoming old. Second, because of all the diet and sedentary lifestyle, you have stopped responding to insulin. That is why you are becoming old. Third, it is a fact of life कि DNA एक टाइम के बाद काम नहीं करेगा. That is why you are becoming old. And what you can't control, telomere छोटा होगा. तो let me start from here कि क्या मतलब है. One by one I will take all into account. What do you mean by telomere? So I'll take you back to your school days. ये क्रोमोसोम है, सबको याद है? क्रोमोसोम के सेंटर में क्या होता है? वो जो डॉट होता है, what is that known as centromere. And chromosome के टिप पर क्या होता है? The terminal part of chromosome has telomeres. How many telomeres? I don't know. I don't know the numbers. You can have lakhs of telomeres, thousands of telomeres. हर किसी का अलग अलग number. If I have to ask you what is the sequence of one telomere, it is going to be TTA triple G. It is going to be TTA triple G. This is one telomere, means it has 6 nucleotides. Like this, you have thousands and lakhs of telomeres. So what I've done, this is you, baby you, at birth, right? This is at birth, let's say you have in your skin, example है, ठीक है, random example, एक cell था. जैसे जैसे you became 5-year-old, 10-year-old, 15, now you're probably around touching 20. So as you kept on getting old, your cells kept on dividing. एक से दो cell बना, from 2 cells you got 4 cells, from 4 8, 8 16, 16 32, 64, so on and so on. तो मैम cells kept on dividing. Every time a cell divides, I will realize ये telomere गायब होता जा रहा है. ध्यान से देखो, it is suddenly becoming white. Can I say that with every cell division, there is going to be telomere shortening? First, I want a yes or no. Has everyone understood? Every time the cell is dividing, the telomere is becoming chota, 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 chota. The telomere is shortening. That is why you are becoming old. There will come a time. Let's assume number wise. At birth, you had 1000 telomeres, a random number. एक बार डिवाइड हुआ, you came down to 800 telomeres. Next division 500, next division 400, 300, 200, 100. One day came, telomere gayab. That is when your cell cycle will say, ab no more cell cycle. There will be cell cycle arrest. Now if there is no telomere, your cell will not divide, and that is the reason that all of us are becoming old. That is the reason for aging that we have. So now you will be like, ma'am, एक average मुझे बता दो. Although you don't have a control over it, but how many times can a cell divide before it becomes stop? Okay, old हो गया, बुढ़ा हो गया. Now the cell can't divide. That is known as Hayflick limit. Hayflick limit is defined as average number of cell divisions. Now just imagine I'm taking an average, which means that includes everything from your skin to your lungs to your GIT to your hair. सबका division ability अलग है. Skin is something which is dividing on a daily basis. Your blood cells are dividing on a daily basis. Your brain is not dividing. I wish it would have been dividing, then we would have had so many brains and so much to learn. Some cells are not dividing, some cells are dividing every day. तो हमने सबका एक average निकाला. The average number of cell divisions that are in a lifetime is 60 to 70. This average I have taken out for a lifetime. So you will wonder, oh ma'am, my skin can only divide 70 times. No, I've taken out an average of all the tissues in the body. In a lifetime, on an average, it can divide 60 to 70 times. Fine. But now I know your question is not that. Your question is, ma'am, मुझे तो old होना ही नहीं ना. I want to be sweet 16 forever. Can I stop this process? If my telomeres don't shorten, then I will be young forever. Till 100, I will look like this only, like sweet 16. God has given you something. You can't use it, but Bhagwan ne diya. It's like to tease you. God has given it to you and you can't use it also. And God has given you something called telomerase. Everyone has it. So who is going to prevent telomere shortening? Telomerase. Hota kya hai telomerase? It is RDDP. RDDP means it is RNA dependent DNA polymerase. What enzyme is it? RNA dependent DNA polymerase. RNA dependent DNA polymerase. God has given it to you. And the purpose of giving telomerase is that it will not let the telomere shorten. So let's assume, have you seen on news channels, they say this is a yogi baba in the Himalayas who is alive since 120 years, 110 years, ऐसा दिखाते हैं ना. Sometimes we think it is just for TRP and it is false, but sometimes it is true also, because there are some very very few people in the world. भगवान ने आपको मुझे सबको telomerase दिया, but some people ended up increasing that telomerase. God ended up giving them a lot of telomerase. Because God gave them a lot of this RDDP telomerase, they did not have any telomere shortening. मतलब birth पे जितना telomere था, at the age of 70 also they have the same telomeres. At the age of 80 also they have the same telomeres. So they will never get old. What lucky people. And that is why they will never have aging. Can I say people who end up having lot of telomerase, RDDP, they are amar, they are immortal. That is why telomerase is known as immortality gene. You and I, we don't have it, because you must have started noticing that as your age is increasing, you are seeing changes in your body. So you know for a fact that, okay, God has given me very little telomerase, I am not the blessed one. But if God gives someone a lot of telomerase, that person is going to be amar forever. So now, of course, I know what your question is, that let's, ma'am, consider that I want to live for 100 years. अब God ने तो मुझे telomerase नहीं दिया, but I want to live for 100 years. So how can I increase my lifespan? God has given you another gene. Maybe you can use that and become 100 years old, 120 years old. Sirt gene. What is Sirt standing for? Sirt stands for Sirtuins. Sirt is going to stand for Sirtuins. Before that, I don't know how many of you have read it in the news channels or not. Have you heard something about Sirtuins happening in the news channels? Sirtuin, I'll just tell you a headline. Nowadays, a lot of studies are going on where they say that you should go for 12-hour fasting. People are doing 3-day fasting. सबका pros and cons होता है, but people are saying that if I fast for 12 hours, I will live longer, my skin will become better, my hair will become better. If I fast for 24 hours, 36 hours, my body will go into ketosis, I will live better. तो फास्टिंग को इतना क्यों एम्फोसाइज कर रहे हैं? दे आर सेइंग इफ यू फास्ट, इफ यू स्टॉप पुटिंग ऑल दैट जंक फूड इनटू योर बॉडी, इफ यू फास्ट, something is happening in your body which will help you live longer. Pehla news article that came. Second news article that came was that, which everyone was very happy to read, was that red wine consumption can increase your lifespan. The day this news article came, I can't tell you how happy everyone was because red wine consumption written, but that was such a wrong headline because they've just found out that red wine has some things which will increase your life. But how much of red wine should you have? Quantity, frequency, ये तो बताया ही नहीं, but everyone got very happy. So now I'll tell you the logic behind it. The logic is God has given you some enzymes some genes called the Sirt genes. Sirt stands for Sirtuin. So Sirt1 to Sirt6 genes God has given you. And these genes are going to make some proteins called the Sirtuin protein. Sirtuin protein क्या होता है? उसका enzyme activity क्या होता है? Sirtuin protein is a histone deacetylase. ये रटना पड़ेगा, tough part. God has given me Sirt genes. Sirt will make what? It will make Sirtuin proteins, and that is a histone deacetylase. What will Sirtuin do? Sirtuin is really going to help me. This histone deacetylase, I'll remove this image from over here. This histone deacetylase will help me in doing a lot of things. Number one, it will say, I will help you in anti-aging. I will decrease your life. I will increase your lifespan. I will make you 100, 120 years old. Next, I will help in repairing your cell. कोई damage कर भी रहा है ना, like air pollution, water pollution, I will repair your cells. Number 3, it knew कि आपकी body में एक time के बाद insulin नहीं काम करेगा. So it will say, never mind, I will help insulin work. I will increase the insulin sensitivity. That is what Sirtuin does. And imagine, देखो भगवान ने दिया आपको सब है. Whether you use it or not is up to you. God has given you Sirt gene which will make a Sirtuin protein. That is an enzyme. That enzyme can help you live for 100 years. It can repair the cells in your body. It can improve your insulin sensitivity. But now it's up to you whether you increase them or not. So you'll say, of course I want to increase them, ma'am. How can I increase the Sirtuin? Number one, I'll say, stop eating food. Doesn't mean don't eat food. They are saying decrease your calories by 30% of what you're eating right now. So if you calculate whatever you're eating right now, if you decrease it by 30% of what you're eating, that can help you live longer by increasing Sirtuins. And secondly, of course, what everyone will be very happy to read is going to be red wine consumption. So red wine consumption se bhi Sirtuins increase, and that is how it can help in all of this. So if someone asks you, what are the 2 ways by which you can live longer? Eat less, drink more. Just a way of learning. I don't promote this, okay? Eat less and drink more. That is how you can live longer, is how students learn it. So now if someone asks you, कि अच्छा Sirtuin तो मतलब if not everyone can eat less and drink more, na? What if in the future some pharmaceutical company makes a tablet of Sirtuin and says, कुछ नहीं करना ये सब, just eat Sirtuin. Can you imagine what a breakthrough discovery it will be कि मार्केट में Sirtuin का टैबलेट मिल रहा है, Sirtuin का टॉनिक मिल रहा है, Sirtuin का पाउडर मिल रहा है, mix it in water and drink it. You will end up having all these effects. So what are the benefits of Sirtuins? The day it happens, it will be a breakthrough in the field of medicine. Number one, what are the benefits of Sirtuins? Ma'am, you just told us it is going to make me live longer, anti-aging. Number two, you told us it is going to repair the cells. That means if someone has cancer में तो सेल खराब हो रहा है. If I give him an injection of Sirtuin, ऐसा कुछ बन गया, then maybe it will be used in the treatment of cancer also because it will repair the cells. Number 3, you told me that it is going to increase insulin sensitivity. इंसुलिन का काम अच्छा कर रहा है, मतलब डायबिटीज का पेशेंट विल बेनिफिट अ लॉट फ्रॉम इट. It can be used in the treatment of diabetes mellitus. So now tell me, what are the benefits of Sirtuins? Number 1, it will help in anti-aging. It will repair the cells, so it will be used in treatment of cancer. Number 4, it will help in insulin improvement, so it will be used in treatment of diabetes. The day someone comes up with the medicine of this wonder drug Sirtuin, person will live longer, will not have cancer, will not have diabetes. It is going to be the most breakthrough thing, but it will take many years to come because it's not that easy to make something like this. Okay, so finally, all said and done, you will see one table, one graph in Robbins, copy pasted from Robbins only, which you will ask you. I want you to get oriented कि इसमें क्या दिखा रहा है. They are trying to show you the cell divisions on the x-axis, how much your cell is dividing, and they are showing you the telomere length. And you're like, ये तो पता है मैम मुझे. Let me study for somatic cells. Let's say the cells of your skin. What is happening with time your cells are dividing? Of course ma'am, skin तो divide करेगा. What will happen to the telomere length? Of course छोटा 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 छोटा, one day it will go and the cell is going to die. That is what we studied. So for somatic cells like skin, this is what happens. It is obvious. It will keep on, telomere will keep on decreasing, decreasing, decreasing. Then our skin will become wrinkled, saggy, वो सब हो जाएगा and we will die. But they will ask you which is the cell जो divide करता जाता है, करता जाता है, करता जाता है, but the telomere length does not decrease. It can divide forever. वो God has made that cell amar. That is germ cells. Germ cells are going to be, can you see telomere उतना ही रहा. It kept on dividing, but the telomeres were 1000, let's say, and still they remain 1000. Why? What must have God given them? Ma'am, God has made germ cells amar. You said if someone wants to become amar or immortal, God must have given it a lot of telomerase, and that is the question. Which cell has the maximum telomerase activity? And that is going to be the germ cell. So this graph tells you two things. सबसे पहले, which cell will always remain amar, which is going to have maximum telomerase activity? That is going to be germ cell. Question 1 हमें समझ आ गया. Question 2 is that what is the role of cancer? क्यों लिखा था इसके अंदर मैम? देखो कैंसर सेल ना इज वेरी स्मार्ट. कैंसर सेल चुपके से ये क्लास सुन रहा होता है. कैंसर सेल को पता है कि इन अ नॉर्मल ह्यूमन बीइंग व्हेन दे विल डिवाइड देयर टीलोमेयर्स विल गो डाउन एंड दे विल डाई, राइट? बट कैंसर सेल नोज, ये क्लास उसने भी सुना, कैंसर सेल को पता लगा कि जर्म सेल्स डोंट डाई. Germ cells have a lot of telomerase. God gives them telomerase. So cancer cell says that if I don't want to die, cancer cell wants to live in our body forever. It says अगर मुझे अमर रहना है, if I want to live in these people forever, I will have to get a lot of telomerase activity. Can I say in cancer cell is listening to this class and he knows कि how, what is the trick of living longer. Cancer cell will say I will do reactivation of which enzyme in my cell? I will do reactivation of telomerase, because if I increase my telomerase, देखो let's say this is a skin का cell, normal skin आपका मेरा, it was dividing, so the telomeres were becoming छोटा छोटा छोटा. Suddenly over here at the age of 50 years the skin said कि कैंसर हो रहा है. मे बी उसको बहुत ज़्यादा UV लाइट एक्सपोजर हुआ, कैंसर हो गया. These cancer cells said कि अभी तो हम मर जाएंगे, I don't want to die. So what did these cancer cells do? They decided to reactivate their telomerase. Once they got the telomerase, they become immortal, they become amar. That is, now they will live forever and ever. They might live normal से भी ज़्यादा. They might live excessively. So cancer cell is listening to this class and knows how to live longer. Reactivate your telomerase. Are the two questions related to this graph also okay? Because now I will take you to a movie which was the Pa movie. Do you remember? Have you all seen Amitabh Bachchan's movie Pa? Have you? Yes or no? Because in that there was a syndrome explained called progeria. Because if you've seen that movie, I can explain better. That is a situation of premature aging. अभी तक you are asking me how to live 100 years to 120 years. Now I will get you to people who can only live for 10 years, 12 years or 15 years and they die off. That is premature aging and that is known as Progeroid syndrome. Now if you've seen the movie Pa, in that Amitabh Bachchan's character had a disease called progeria. वो Bollywood movie था, वहाँ पे progeria बोल दिया. Progeria is not a disease. Progeria is a syndrome. It has many diseases under it, but they did not want to tell such tough names to people. So they said that character has progeria, khatam. Simple way, progeria means premature aging, but progeria is a syndrome. It has many things under it. 3 things to be precise that you have to know, which we should read. Number 1 is known as Werner syndrome. Werner syndrome ka onset is going to be adult. What does this mean? This means when the child is 5 years old, 7 years old, 10 years old, 12, 13, 14 years old tak, mother is not knowing. Mother says my bacha is fit and fine. Bacha is also going to school, enjoying life, fit and fine. As the kid approaches adolescence and adulthood, 15, 17, 18 years, suddenly the kid starts having graying of hair, old age wali cheezein, graying of hair, memory loss, cataract, all old age things start coming up. Person starts having premature aging, but does it start in childhood? No. It starts at an adult age, adolescence age. So Werner syndrome, and this is because of a defect in an enzyme that is known as DNA helicase. What is the defect that you see? It is a defect in the DNA helicase enzyme, which is also an MCQ जो पूछा जाएगा. Werner syndrome is a defect in DNA helicase. Please do not confuse this with Werner syndrome in medicine. एक और syndrome होता है, दोनों अलग अलग. Werner syndrome is this progeria syndrome that I'm talking about. Werner syndrome, which has M in it, is the other name of Men-1 syndrome. Do we guys know what is Men-1? Have we studied it anywhere in any other subject? Especially in physiology, last year you must have studied. It is known as multiple endocrine neoplasia 1. And जिन्होंने नहीं पढ़ा, if I can explain it in 5 seconds, मल्टीपल नियोप्लेजिया, नियोप्लेजिया मतलब कैंसर्स, ट्यूमर्स. तो पेशेंट में बहुत सारे ट्यूमर्स होते हैं. एंड विच कैटेगरी ऑफ ट्यूमर्स? एंडोक्रीन सिस्टम के ट्यूमर्स होते हैं. एंडोक्रीन सिस्टम मीन्स थायराइड, पैराथायराइड, ऑल ऑफ दैट. सो इफ द पर्सन हैज मल्टीपल एंडोक्रीन नियोप्लेजिया 1 टाइप, दैट इज वर्मर, M फॉर M. Men-1 का दूसरा नाम वर्मर, नॉट वर्नर. वर्नर इज गोइंग टू बी DNA helicase problem, progeria syndrome. You say no ma'am, but I saw Amitabh Bachchan's character in Pa movie. I'm giving you one homework also. नहीं देखा तो online देखना. On some OTT platform it must be streaming. You watch Pa movie, you will see that in that character there was childhood onset. The character, if I also watched it long ago, but I think by 5 years he had grey hair, he had gone bald also. 10 years tak he had cataract also. 13 years or something he had stroke, a brain stroke, and he died also. So everything was happening very fast. It was a childhood onset. So in that movie what they were trying to show you was Hutchinson-Gilford syndrome. The child got old so quickly that by age of 10 or 12 or 13 he died also. Hutchinson-Gilford syndrome is a defect in a gene called LMNA gene. LMNA का full form होता है lamin. LMNA gene is the full form of lamin gene. Let me tell you, you and I, we have lamin gene. Do we all agree that हमारा जो nucleus है, ma'am, we always make the nucleus like this, nice and round, yes? Why is this nucleus nice and round? तो न्यूक्लियस का जो मेम्ब्रेन होता है दैट इज इंटैक्ट बिकॉज ऑफ विच जीन? थैंक गॉड, एंड थैंक गॉड दैट ही गेव अस LMNA जीन. दैट इज व्हाई आवर न्यूक्लियस इज नाइस एंड राउंड. बट इफ देर इज अ पर्सन विद LMNA जीन डिफेक्ट, कैन यू सी हाउ हिज न्यूक्लियस इज लुकिंग? मैम, नाउ द न्यूक्लियस is looking all irregular. This is what results, and if you remember, the Pa character looked exactly like this. This is what is resulting in the syndrome that I'm telling you, that is Hutchinson-Gilford syndrome. Can I say Hutchinson-Gilford syndrome can be defined as a laminopathy? Hutchinson-Gilford syndrome can be defined as a laminopathy because it is a lamin gene defect. So you will say, ma'am, gene defect ho gaya, this person will to die because of this. Can you save? See, gene defect mein I can't do much, but thoda sa, maybe he was dying at 13, I can give him some drug that he can survive till 20. I can at least increase his lifespan. So now they have come out with a drug called lonafarnib. Under trials hai, but this is important for exactly your short note. Lonafarnib, name has it. Pharmacology you are studying with Ankit sir, and you must have seen everything is in the name. So farnib means it is a farnesyl. Farn will tell you it is a farnesyl transferase IB. IB matlab it is an inhibitor. It is a farnesyl transferase inhibitor. They are saying that if you give lonafarnib, the nucleus can actually come back. Lonafarnib is making sure that the nucleus starts looking round again and the person can survive for a longer time. इस disease का नाम है Hutchinson-Gilford syndrome. एक और होता है premature aging, Cockayne syndrome. Cockayne syndrome is a defect in ERCC8 and ERCC6 defect. These are also genes that are there. How I have learnt it, Cockayne has a lot of Kerker sound, so the genes also have a lot of Kerker sound, and the patient is also going to have a lot of Kerker cachexia. Cachexia means the patient will be very, very thin, very lean. So Cockayne is ERCC and ERCC6 and 8 defect, and the patient is going to have cachexia. Are we done with all the progeria syndromes and we are ready to move on to the last 5 minutes of today's class? And that is, I take you back. That I taught you everything about telomeres, insulin, but I didn't teach you the most common cause, which is a separate question, short note in the exam, which is a separate question that is short note in the exam, and that is going to be free radical injury. देखो अलग से question हो सकता है ये आए, what is cellular aging, short note, तो सब कुछ लिख के आना, including free radical injury. If you just get a question on free radical injury, then you just write free radical injury, because that is the most common cause of cellular aging. That is the short note. Should we do that? 5 minutes last. Do you have the patience? To be very precise, I have 5 slides to teach you. I hope you are not slept off, right? I know it's a lengthy class, but I know other classes are even lengthier. But as I told you, November, December classes were 2 hour 15 minutes, but Jan onwards classes will be 2.5 hours at least, so that we can cover the syllabus. वरना कोई फायदा नहीं है. तो free radical injury, most common cause of cell injury हमें पता है. Cell aging, we know that. Okay, we are getting old because of this fellow. So this is the one you have to hate right now. He is making you old. What is free radical injury? They are known as ROS. ये हमने स्कूल में पढ़ा था. They are known as reactive oxygen species. They are coming from oxygen. So now whenever you are inhaling oxygen, you can't control that. You need oxygen. You are inhaling oxygen. You will continue to inhale oxygen. Oxygen is not the problem here. With oxygen, you are inhaling pollution. You are inhaling chemicals, toxins, poisons. Oxygen and poisons milke, they make free radical injury. And what do they cause? These are going to cause problems in your lipid peroxidation. Matlab they go to your cells, lipid kharab. Go back 1 hour back in time travel karo, वापस जाओ. Lipid kharab hua, which pigment is formed? Quickly tell me. The pigment that was formed when lipid was getting destroyed was lipofuscin. Yes ma'am, the question that you told us was lipofuscin is a telltale sign of free radical injury. ये line याद आ रहा है सबको? Old age में free radical injury increases. Yes, तभी तो lipid peroxidation increases, तभी lipofuscin increases. Do you remember this everyone? Yes. Now I teach you free radical injury. के बना कैसे? How from oxygen is this forming? So I have not drawn it because all of you will be drawing this with me. This is one of the most. एक table में सब हो जाएगा. This is oxygen because we are breathing oxygen and we don't have a control over it. But along with oxygen, if we are also having exposure to a lot of poisons and toxins and chemicals and the bad AQI, water pollution, air pollution, जो भी चल रहा है, because of that now ma'am, when they mix with oxygen, something is formed in my body which goes by the name of superoxide. This is the first free radical. Total कितने free radicals होंगे? Total 3. The first free radical is going to be superoxide. Okay, as soon as superoxide is formed in your body, the next free radical formed is going to be H2O2, and that is known as hydrogen peroxide. The next one is known as hydrogen peroxide. कैसे बना मैम हमारी बॉडी में? हमारी बॉडी में there is an enzyme called SOD. What is the full form of SOD? It is superoxide dismutase. The full form is superoxide dismutase and H2O2 will form. ठीक है, तो second free radical भी बन गया. This H2O2 will then convert into the third and the last free radical, which goes by the name of hydroxyl. कैसे बना? By metals. Either because of copper it formed or because of iron it formed. But there's a reaction. When iron changes from Fe2 plus to Fe3 plus, that is when H2O2 changes to hydroxyl. थोड़ा chemistry बताना. Fe2 plus was what? Ferrous, ferric. I've forgotten. What is Fe2 plus? Fe2 plus was ferrous and Fe3 plus was ferric. Do we all remember this? Am I right on this? So basically they will ask you what changes to what. So ferrous changes to ferric, and when that change happens, that is when H2O2 changes to hydroxyl. So khatam, 3 free radicals are ready. Tell me the order. The first free radical formed in your body is superoxide. Superoxide is acted upon by superoxide dismutase. Second free radical is formed, that is hydrogen peroxide. That is acted upon by metals like iron and copper, and the third free radical, hydroxyl, is ready. So now they will ask you what is Fenton's reaction in this. And you're like, अच्छा, Fenton's reaction में तुक्का लगाना हो तो Fenton has the word iron, Fe. It must be the iron wala reaction. So if I have to highlight it, H2O2 changing to hydroxyl in the presence of iron, this iron wala reaction must be the Fenton's reaction. Is that easy to learn? Fe for iron and Fenton reaction is the iron wala reaction. Now, 3 free radicals are formed. Tell me which is the most dangerous. Which is the most dangerous free radical or the most potent? मतलब maximum damage कौन कराता है? Oh my God, very deadly. The oh my god deadly one is the oh my god. It has it in its name. The hydroxyl one is going to be oh my god wala. Very, very deadly, very, very potent. Free radical ban gaya. You know how to make a short note if free radical formation comes. But then if so much was happening in my body, ma'am, then I should have become old at the age of 5 years only. Nowadays, when kids are born, they are exposed to all the pollution. They would become old at the age of 5 years. No, they are not, because God has also given you something to protect you. God has not left you, ke jao, mar jao. So God has given something to protect you also. And the first one that God has given is that please, He's given you advice that please include antioxidants in your diet. Have you ever wondered why your parents keep telling you in the hostel that don't survive on Maggie and bread? Please eat some green leafy vegetables, please eat some fresh fruits, because those contain vitamin A, C and E, and vitamin A, C and E are antioxidants. They will break these free radicals. Next time your parents tell you to eat fruits and vegetables, listen to them. They're telling you to eat vitamin A, C, E. Second, God has given you some transport proteins. Now, what is the purpose of giving transport proteins? Is, remember I told you no one is allowed solo travel in the body. Iron क्या अकेले travel करेगा? नहीं. Copper अकेले travel करेगा? नहीं. ऐसा क्यों हुआ? Why did God say कि अकेले अकेले नहीं travel करना? No solo traveling. Nowadays it's trending, but why is God against it? So God said that iron will not be allowed to travel alone. Iron will always travel with someone buddy called transferrin. देखो transportation के लिए God has given it transferrin. Copper will not travel alone. Copper will always travel with ceruloplasmin. Any reason? Because the rule of the universe that I want to tell you, which you will also see sometime in life, that whenever someone is in a relationship with someone, when two people are in a relationship, they don't have time for anything else. So now I said, iron को busy कर दो with transferrin. Copper को busy कर दो with ceruloplasmin. If they are busy with their travel buddies, will they have time to cause this Fenton's reaction? Then no iron will cause Fenton's reaction, no copper will act over here. So God has taken that step that okay, इनको पहले से ही busy रखो. You keep them busy somewhere else, this reaction will not occur and this oh my god hydroxyl ion will not form. That is why God has given you transport proteins to save you from Fenton's reaction. And number 3, God knows कि जितना भी save करो, they will live in an AQI of 450. Later on, they will form free radicals. तो free radical को तोड़ना होगा. He has given you some enzymes, and there are 3 enzymes, but I don't want to teach you the way it's written in the book. I want to teach you a little logically, which will take 1 minute. पहला बताओ कौन सा free radical था? Superoxide. Second free radical is what? H2O2. And third free radical is going to be OH. Number 1, God has given you an enzyme called catalase. Catalase will break H2O2. Gaya, H2O2 gone. So which is the first enzyme God has given you? Catalase. Okay. Next, God has given you another enzyme which is known as glutathione peroxidase. What does that break, ma'am? Glutathione peroxidase, like its heavy name, it has heavy work to do. It will break H2O2 also, and it will break the most potent hydroxyl also. Kaam khatam. God has given me such nice things. Catalase will break H2O2, I am safe. Glutathione peroxidase will break H2O2 also, it will break hydroxyl also, I am safe. Who is not being broken? This fellow is not being broken. Superoxide को कोई तोड़ ही नहीं रहा, ma'am. Because God forgot to give me an enzyme. When God forgets something, human beings come up with some jugaad. And what is the jugaad we did? We understood that H2O2 can be broken, hydroxyl can be broken, superoxide cannot be broken. So I said, never mind. Convert superoxide to H2O2 by which enzyme? Superoxide dismutase. ये तो पहले पढ़ा था. Superoxide is converted to H2O2 by superoxide dismutase. Convert कर दो. Once you convert it, there are so many people to break H2O2. Glutathione is also there, catalase is also there. So now can I say superoxide dismutase is helping in the formation of free radicals also, and indirectly superoxide dismutase is helping in the protection against free radical also. Is it having a dual function? Is superoxide dismutase also a protector? So now tell me, what are the 3 enzymes that God has given you for protection? Superoxide dismutase protection के लिए भी है, catalase and glutathione peroxidase. Are we okay with the protectors? Because I can teach you the last slide of the day and get going off with it. Because this superoxide dismutase now seems very interesting. ये वो split personality है. When you want, it will make free radicals. When you want, it will protect you from free radicals. So ma'am, I wanted to understand where all is it present. It is present in the cytoplasm of the cell also. So I call it cytoplasmic superoxide dismutase. It is present in the mitochondria of the cell also. That is mitochondrial superoxide. How simple, cytoplasm and mitochondrial. Kyun yaad kara? Because their composition is different. Mitochondrial superoxide dismutase is made up of manganese. So it is manganese wala superoxide dismutase. Whereas cytoplasmic is the copper and zinc superoxide dismutase. I don't know why they want you to learn this information, but Robbins mein hai aur university exam mein pucha jayega. So some things you have to just take for the fact that I need to learn for the exam, and it will not help me in patient protocols or treatment, but I need to learn for exams. This is one of them. The superoxide dismutase in cytoplasm has copper and zinc, so simple to learn would even become that you learn it as cytoplasmic, copper and zinc, and mitochondrial will have manganese. This is Ratta. Now let's go to patient. What is the superoxide dismutase gene doing in brain? So please remember, it protects the brain against free radical injury. You will say, ma'am, you had told me these three enzymes protect us against free radicals, but brain में तीनों नहीं होते. Brain doesn't have catalase, brain doesn't have glutathione peroxidase, brain only depends on superoxide dismutase for protection. So the brain के लिए most heavily dependent for protection against free radical injury is superoxide. Just imagine someone has a superoxide dismutase mutation, ma'am, उसका तो brain गया. The only person protecting the brain against this entire story was superoxide dismutase, and if person has superoxide dismutase gene mutation, person will land up with ALS. Do you know what's ALS? It's the disease that Stephen Hawking had. What is the disease that Stephen Hawking had? It was amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis. Basic about it I can tell you because you have read physiology. It is a disease of upper motor neurons as well as lower motor neurons. So both are defected. Both the upper motor neurons and the lower motor neurons are affected. It is amyotrophic lateral sclerosis, ALS, which is because the brain does not have its main protector, that is SOD1 gene. Finally, we are done. So if you get a short note on free radicals, first you will explain the entire definition that they are reactive oxygen species, lipid kharab karte hain. Then you are going to make one table of how they are formed. You will make one table of how they are going to how we protect ourselves, and then you will give clinical correlation of everything to do with superoxide dismutase. This will complete your entire flowchart. Sorry, I lied to you. That was not the last slide, but now I'm being honest to you because the last slide truly that you have is ferroptosis, but इसमें मुझे कुछ पढ़ाना नहीं है. That is why I lied to you कि इसमें 2 words बताने हैं and that's it. What is ferroptosis? Everything you know. I'm just bringing it under one roof. तो मुझे बता दो. Ma'am, you taught us apoptosis, मतलब cell death, necroptosis, cell death, pyroptosis, cell death. ये ferroptosis क्या है? This must be iron वाला cell death. Exactly, and I've just taught you that. Iron-induced cell death. Where did I teach you? Because did I teach you something called the Fenton's reaction right now? Yes. And now you're like, अब मुझे पता है ma'am, that was iron वाला cell death, because if iron will come, it will make free radicals and free radicals will cause cell death. Can I call it iron वाला cell death? Iron वाला cell death is ferroptosis. That's why I said I've taught you. And who is the master regulator who causes this ferroptosis is an enzyme called glutathione peroxidase 4. The enzyme glutathione peroxidase 4 is going to cause this entire iron wala cell death. Hota kya hai? If I draw this as a cell, ma'am, number one, you are saying iron आके क्या करता है? When iron comes and causes cell death, it causes cell membrane damage. The cell membrane will be gone. I want to ask you a question. Cell membrane was damaged in necrosis or in apoptosis? As far as I remember, apoptosis में तो we had done the story that one big cell had broken into small pieces. Damage नहीं हुआ था, छोटे pieces बन गए थे. In necrosis, I had told you that the cell membrane was getting damaged. So can I say in ferroptosis also, देखो नाम में सुनने में it looks like apoptosis, but it is not. It is not like apoptosis. In this, the cell membrane gets damaged. That is why it is going to be a case of necrosis. What else? Then let me look at the mitochondria. They are saying that the mitochondrial membrane will also get damaged. So the outer membrane of the mitochondria is going to get damaged. And what is inside the mitochondria? Ma'am, we have these kind of folds. इन्हें क्या बोलते हैं? These are known as cristae. They are saying that the cristae will also get lost. There is damage to the cristae. So what are the effects of iron in cell death? Iron आके cell death कराएगा, तो cell membrane is lost, mitochondrial membrane is lost, mitochondria cristae are lost. Who causes all of this? This is caused by an enzyme called glutathione peroxidase 4. What is it similar to? Necrosis or apoptosis? It is similar to necrosis. Finally, this short note, very rare chances of getting ferroptosis. If आया तो this much of information is enough because this much is known. Beyond this, it's a very new thing. They don't know more about it. I just want to wrap up one or two questions before we go ahead. Which of the following pigments are involved in free radical injury? Jaldi jaldi. This is something which is going to be very simple for you now. What is involved? Free radical injury, ma'am, lipid peroxidation कराता है. Lipid peroxidation की वजह से it is going to lead in the formation of lipofuscin. I think we know that. Next, Werner syndrome is a defect in what? I just not taught you. Werner, not Vermeer. Vermeer was men 1. Werner is progeria, and progeria is because of what? It is because of DNA helicase defect. Perfect. One more question. Hutchinson-Gilford progeria syndrome. ये वो पा मूवी वाला बच्चे में था. It was a laminopathy. If I say laminopathy, you will say it is to do with LMNA gene mutation. So can I say it is going to be to do with lamin A gene mutation? Are we okay with this? Because these are just a few wrap-up questions just to test your memory. That's it. Otherwise, ऐसा कुछ इसमें tough था नहीं. And that's a big thank you for making the first class of 2025. So thank you so much guys for joining and study well.